Hi, Chair, we're live now.
Thank you. Good morning, everyone. I would like to welcome all councillors, officers and members of the public viewing on YouTube to this meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny Panel. My name is Councillor Vic Pritchard and I am the chairman of the panel. I would now like to read out the names of other members of the panel and ask them to confirm that they are present. So I'll start with Councillors Michelle Doherty.
Present.
Jess David.
Present.
Ruth Malloy.
Yes, hello, present.
Andy Waite.
Present.
Paul May.
Present.
Mark Roper.
Present.
Liz Hardman.
Present.
And Alison Bourne.
Present.
The panel also has 3 co-opted members, and they are David Williams, apparently apologies for him, Chris Batten.
Present.
And Kevin Burnett.
Present.
Thank you. Also present are the report authors for the items on today's agenda, and they will be introduced as we make our way through the agenda. Can I remind members and officers to keep background noise to a minimum, to only speak one person at a time and not to speak over others. Please mute your microphones when not speaking and then unmute when I invite you to speak. Please indicate if you wish to speak by using the chat facility on Zoom by typing MIS, may I speak, and I will call you to speak in turn. Should the panel need to take a vote in order to expedite the result, I will assume a majority position. So if you wish to abstain or vote against, please indicate this on the chat when moving to the vote. So move on to item 2, apologies for absence and substitutions.
Chair, just to confirm, like you say, apologies received from David Williams, and also our Children's Services Director, Mary Kearney-Knowles, has sent her apologies.
Thank you. Item 3, declarations of interest. Are there any declarations of interest? Paul. Paul May.
Paul, you're on mute.
Sorry, thank you. I'm a non-executive director on the board of Serona, which is a health and care company. And if anything comes up relevant to that, I will declare that interest again. Thank you, Chair.
Thank you. Any further declarations? I don't see any, no. So we move on to item 4, urgent business agreed by the chair. There is none. Item 5, public councillor statements and questions. There are none. So I go on to item 6, and that's the minutes of the 19th of January 2021. Can I take those as a true and accurate interpretation? Can somebody nominate that, please? Michelle, thank you. So if we go from matters arising and we go on to page 6, and there's Councillor Ruth Malloy referred on to page 41 on the 23rd of October 2020 minutes, asked Sean Walker McAllister would send further information on Got Your Back River Safety Campaign. There was a commitment that the Director of Adult Social Care Complex and Special Commissioning replied that she would pursue that and forward anything she receives. So Ruth, is that the situation?
Yeah, Leslie Hutchinson was very good and wrote on the day of the meeting, the last meeting on the 19th, to me and others about various things, and included a request to Samantha Jones or Chris Wilford to send me some information, but as of now, I haven't actually received it. So Thank you, Leslie, but I still haven't heard, or it's gone off somewhere else, but I haven't received it. So I'd still be interested. Thank you.
Can Ruth be assured that she will get a reply?
I will do a chasing email right now, but thank you, Councillor Malloy. I did do it as we were in the meeting, didn't I? I'm a little bit surprised, so I will just do a quick check. So apologies for that. Chris, I'm not sure whether you're aware of that.
I corresponded with Sam Jones, but neither of us are aware of this programme. So if Sian has more details of it, we can find out about it. But I have no awareness of that programme, and neither did Sam Jones. Okay,
I'll follow it up with Sian.
Can I just come back? There were two things. It was the Got Your Back campaign, but also the Never OK campaign, about anti-bullying. And I'm aware that they're both, are doing a lot of work in universities. It was more about the schools, how embedded those two campaigns are in our local schools, especially secondary schools. Thank you.
I'll follow that up right now. Apologies.
Okay, thank you. And Kevin, you were given a commitment that there would be an update on the inclusion expert, which is on the top of page 7. Have you had such an undertaking, Kevin?
I can provide that update now if that's helpful.
Yes, thank you, Chris. Thank you.
I can, yeah. Also, exclusion expert has been again by COVID, as in it's not been able to return to the schools during the third lockdown, which we hoped they would be back in. The work very much happens in schools. They were working with a number of children who've also now moved on into secondary schools. So it's not been ideal, but what we've agreed is that we've got a number of days left which the schools can use. So the schools which are working the project, they've all now been contacted by Inclusion Expert, and they are requesting individual pieces of work which Inclusion Expert can carry out in each school. So, for example, I know one of the schools has requested that SEND review be carried out to support them with their work. Once those days have been completed, we'll ask Inclusion Expert to provide a final report to the local authority. But it would be fair to say is that the journey is very different from where it originally set off from. And that's simply because they've not been able to work in schools because they have been not accepting visitors.
Thank you. And Chris, you did mention at the same time about the subgroup about the attainment gap and whether anything's happened there or not yet. Bless you.
Yep. We have met. We've got a proposal for all the schools in Baines around how we can support the improvement of attainment around children and free school meals. We are meeting on the School Standards Board is meeting on the 30th of March, I believe, Tuesday 30th of March, which that will be one of the agenda items which we will consider.
Thank you very much.
So, Kevin, you have another consideration on page 8. You asked if an update could be provided on Operation Encompass.
Thanks, Vic. Following Alison, Leslie again was brilliant in doing her email that day. The Operation Encompass, I think that Leslie had asked Bruce to ensure it's on the DAP and Chris to do an update setting out where we are with rolling Project Encompass, which I don't think I've had just yet, Leslie, unless I've missed something. And the sorry, Vic, there was two things you said there, Project Encompass and one other. The escalation protocols, Leslie, which again was seeing whether that might be finalised version or when it might be out.
Yeah, so I can't answer the Operation Encompass. I'll have to defer to Chris on that. But the escalation protocol, I have checked. It is in draft form. It's being signed off by the 31st of this month to be implemented from April going forward. So I have had confirmation of that.
Okay, thank you. Again, still on page 8, Councillor Paul May asked how the COVID-19 vaccination programme was progressing locally, particularly in terms of residents within care homes, and the answer provided by Councillor Appleyard is that he believed it was going well, and that a more accurate report would be given by the end of the week. Councillor May, did you get sight of that more accurate report?
No, Chair, I didn't. But I think the important thing that I was coming at is there's lots of care homes which are beyond the direct control of the council, and it was seeking reassurance that all the government was saying was all care homes have been done. We're just checking that they had been done. So I think a yes would suffice as far as I'm concerned. Thank you, Chair.
Yes.
Right, good. That's kind of answer we need. On page 18, the Commissioning Manager for Mental Health replied that the deadline for submissions was the end of February, but this allocation date was unknown at that stage. Can I ask, is this allocation date now known?
No, there's working. Is this the allocation of fundings towards for projects that might be funded by the CCG?
It doesn't specify that here.
If that is the case, then the prioritisation process is taking place now. So it's not yet concluded, and we're working through that with CCG colleagues.
Yeah, that was the funding.
Yeah. So an enormous amount of bids have been provided to the CCG, and they are having to go through quite a detailed prioritisation process. Bryn Bird, I'm not sure whether you want to add anything to that.
Yeah, I mean, that process is not complete. There's well over 100 requests, so obviously quite a challenge to prioritise those and reflecting on the financial position and the development of the care model and white paper alongside that. So that's a development process that's taking place with partners.
Okay, thank you. Page 19, Councillor Alison Bourne commented that early intervention is crucial and that the problem of waiting times for assessments needs to be addressed. The Senior Commissioning Manager for Specialist Services replied that this was an issue that she could take away and discuss further with the SW colleagues. Is there any outcome to date from those discussions?
So there has been a huge amount of discussions around the waiting times, actually. Was this for autism spectrum disorder? Was that the waiting times that we're talking about there?
Sorry, no, I don't think it was. I think it was.
Oh, which one was it?
I think it was CAMS, but also adult mental health. It was basically all mental health services. Waiting times appear to have gone up significantly.
There is work taking place around that. I haven't got the exact answer to that though today. I'll email Debbie forward and get a written response for you, Councillor Bourne. I know you've had quite a lot of detailed conversations with Debbie forward, haven't you yourself, since the panel, but I will get more information for you on that.
Thank you.
And on page 25, Kevin Burnett asked how work will be delivered in early years SEN when the vacant post is deleted. The Director of Education, Inclusion and Children's Safeguarding replied that proactive enabling work is ongoing to make sure that children continue to have a voice within this work area. And we're looking for clarification on that one.
Yeah, sorry, Chris. I had two extra little notes that you mentioned in my notes, and I just wanted to confirm whether I've got this right with you, Bless. The first bit was that the early years model was changing to be more proactive and a re-enablement model including a use of a helpline, which should allow for the removal of the post. That was one point. And the second point I thought you mentioned was that the importance of SEND advocacy, and that was about voice, and that it may be a short-term move, but you need to look at that with the schools.
Yeah, just to clarify my answers, yeah, in the right area. But I think the detail of what I said was for the early years SEND work, for some time we've moved to a different model whereby we're doing more training with schools rather than trying to be reactive and deal with individual circumstances. So we're trying to empower the sector, which has really worked for us. We've been working in that way now for probably about 18 months. This has been a vacant post, and there's certainly there is no need to fill that post to work in the way that we were doing previously. So that's ongoing, that's working well. And the advocacy one is the contract's up for renewal. So a decision about whether it needs to be funded through high needs, which is where I think it should be funded, when they need to go to schools forum.
Okay, thank you all. There's an unusual number of matters arising from the minutes, but we can move on now. So if we move on to item 7 and cabinet member updates, and if I can ask Rob Appleyard first to present his report, please.
Good morning, Vic. Good morning, panel. I like your beard, Vic. New edition.
Yeah.
As requested by the panel, you've had the report in advance to go through, so I'm obviously open to any questions.
Right, thank you. Any questions to Rob? Liz?
Morning, Rob.
Morning, Liz.
It's the second section that I'm interested in, and it's about the Community Resources Centre and Extra Care Services. And these were transferred on the 1st of October 2020 from Sirona to the council. And
Correct.
The focus is now on reviewing staff salaries and terms and conditions and 2P. But do you anticipate there will be any job losses?
I'm not aware that that's an anticipation. I mean, certainly not. I think more than anything else, it's actually enhancing the staff position within the organisation. There are adjustments because moving into the council, there are slightly different enhanced rates, and we've just got to really tidy all this up. But certainly not, because we value those staff on there. And if anything, I think we will possibly look to enhance the quality of the staff there, given the opportunity when we're reviewing staffing levels.
Thank you. That's good news. Thanks.
Right. Any more questions for Rob? Kevin.
Vic, sorry, just only a quick one on the hub. Is the how are the people identified for the food parcels, please, Rob? And do we know if anyone's been missed or don't know how to access that?
Well, as you can appreciate, it's been an extremely comprehensive piece of work from the very beginning. When the hub started off March last year, the government supplied us a list of the extremely vulnerable, to which we, once we sorted out the data allowance, how we were allowed to contact these people, everybody was contacted. The subsequent list of 2,034, I believe it is, they've obviously been contacted as well. Now, in terms of food parcels, the government ceased doing the direct food parcels, but we have actually picked up any need, and that's where it gets picked up from. We have had nearly 12,000 calls into the Wellbeing Hub, and in amongst those calls, there have obviously been requests for support, be it sometimes just short term while they go through a particular situation, and we've responded to that. And on top of those food parcels, as you can see, there's been an enormous amount of frozen meals distributed, and that's obviously been provided by some of the supporters in our communities, some of our businesses. So I think the way it's set up there is not a need for anybody to go without food or access to food, and that's really important. But from that, food, the requirement of food sometimes tends to be just one of the challenges that those people are maybe suffering, and the benefit for the hub and the way it's set up with its pod working, those other issues can be seamlessly picked up and support being provided, or people signposted to those right areas. The model of the hub itself is, is something we should be immensely proud of. We have other authorities coming to us and asking us how it's, how it's working, how it was set up, and those benefits. So it has been a good piece of work.
Thank you very much.
Jess.
Thank you. A related question, Rob. I wanted to also ask about the food provision and emergency food parcels. Is this now an ongoing service, or is there an end date for provision? Just thinking about the future end of furlough and the likelihood that more households will experience hardship.
Well, in terms of the technical piece of what the government does in terms of furlough and everything like that, we can't really give an answer on that because they've got to tell us. But if we get a request from somebody who is in need of food and it's assessed, anything like that, we're not going to not supply them with some food or tie them into either the food banks or more primarily the food pantries. And the food pantries are a brilliant piece of resource. And as I said, there's no reason for anybody to feel that they cannot access food within this authority. And that will be, as far as I'm concerned, that will be ongoing. And I'm sure, and I think Les, he signs off allowances for food provision, I believe. Yeah.
So at the moment, Rob, it's been funded by government money. So when that comes to a close, you're suggesting there would be an element of continuity. So that would have to be funded by the council?
Well, it will be funded by the council through the hub because we're in a fortunate position that a lot of our food banks and food pantries have a good stock of food. The people in Bath on Baines are extremely generous. And so there is no reason, and so we just have to navigate the right way to get that food to those people. I would see no issues in actually doing that, and I wouldn't expect to see any issues doing it either.
No, okay, fine. I have no more speakers, so Rob, thank you very much. I think you've got off rather lightly, so I'm going to ask if
Can I just say one final thing, and I know it possibly will come to the end here and everything like that. I'm immensely grateful to the support that Les Hutchinson has given, obviously myself, and I'm sure the panel over the years, even before my time, and you would have experienced that, Vic, and everything like that. And this is Leslie's last meeting, and I just really want to give a sincere thanks to the support and the work she's done, and the focus on the individual. Everything she's done has actually focused on the individual, and that comes through in so many different ways. And so thank you very much, Les. And then on the other side of it, could I just say a big hello to Alison Elliott, who is going to be taking over that role for the next 6 months. And Alison comes to us with a wealth of experience, and certainly I am very comfortable with the support and the input that Alison's going to give us over that period of time.
It's a fine acknowledgement. Thank you, Rob. So we'll move on to Kevin now. If you could present your paper, please, Kevin.
Morning, Vic. Morning, everybody.
Good morning.
Yeah, I believe everybody's received a copy of my report, so more than happy to take questions. But before I do that, I'd just like to reiterate what Rob has said. I think Leslie is an exceptional officer, and she'll be sorely missed by us all. Some fond memories of going away with her to a conference down in Weymouth. Very professional officer. She'll be definitely missed by us all. So, yeah.
Okay.
Good luck, Leslie.
Thank you. I'm going to call Paul May, please.
Thank you, Chair. As a previous Cabinet member, the safeguarding work that Leslie did was, I think, exceptional, and this council can be very proud of the work she's done. And I have the full support as well. So we'll all be saying something to you, Leslie. For you, Kevin, can I just ask a couple of issues? You've mentioned quite rightly about the Culverhay site, and I think it's important that the committee actually understand the significance of what's being proposed there, and make sure that we get a minute that fully supports what's going on. The only issue that I would have with that is the reference to Bath College and vocational provision. I think the city in particular has a need for a high quality skills centre. And I think if we can make sure we don't lose that along the way, it would be really important. The second question I've got to ask you, Kevin, which is perhaps a bit more testing, is this is a policy development and scrutiny committee. Looking at the agenda today, there's a generic reference on the suicide report, but virtually no reference to children's services through the report today. And I'm just generally worried that, well, do you feel that we're getting the proper scrutiny of children's services through this committee?
Thanks, Paul. Yes, some very good questions. I'll start with the Culverhay one. No, you're spot on. It is a priority of myself and both the backbench steering group to ensure that skills and vocational skills training is returned to the Culverhay site. It is a priority. You'll be very pleased to note that in the report that the provision for our alternative provision children will be expanded on the site, which is great news because they're some of our most vulnerable children, and they'll be supported with a quality provision at the old Bath Spa part of the site, which is great news. With regards to children's services in general, that's quite a broad point. I think I'd start from saying my experience of being on a panel from your point of view, I would prefer it if children's services and adult services were separate, and that would allow you guys to scrutinise children's services and adult services in more depth. That would be my preferred option, yes, Paul.
You must lobby your colleagues.
No, I think it is important for us as councillors. We all care about both adult services and children's services, and putting them all together in one committee, which is fine. But I feel for the chair, when it gets to 2 o'clock in the afternoon, you know, that we've actually got an immense amount of work that's got to be done. And you just see the amount of time it took to get through matters arising. I think it's an important issue going forward. But with regards to Culverhay, Chair, I would hope we would actually get a formal support for the work that's going on with that within the minutes, because I think it is important that we actually reflect that that is important to the city of Bath in particular.
Yeah, and I'd appreciate that, Paul. That'd be very useful.
Okay, Alison.
Sorry, I always take some moments to unmute myself. Yes, just in relation to the Culverhay site again. I mean, it's fantastic to see that there's, you know, such a lot of effort going into safeguarding that site and ensuring that it is used to meet the educational needs of our residents and other wider social needs as well. But I'm just wondering, you know, when the school closed, I think it did leave a gap for people who live in that area, and it means that an awful lot of kids who live in that area are having to travel a long way to go to school. And you know, that's not ideal. It's far from ideal. And I'm just wondering what the demographics are, and if there is likely to be a need for a local school there at some point in the future. And if that is the case, is that also under consideration?
Thank you, Alison. Yeah, very good question again. Currently, the demographics suggest no. And if we were to approach the DfE to apply for a new school there, they would 100% say no to that application. Unfortunately, you are spot on that the children from that area, that part of Bath, do have to travel to other areas of Bath, which is not acceptable, and really, and it does from an environmental impact perspective as well. It's not great. So to get FE provision on that site, or any form of vocational learning back on that site, I think will help, because at the moment there is a significant lack of facilities for young people in that section of Bath, and I'm making it a priority to ensure that the Culverhay site returns to an educational use.
Thank you.
Okay, Liz.
Well, first of all, I have to say goodbye to Leslie and to thank her so much. I've had a lot to do with her over the years, and we will miss you hugely. I won't take up any more time, but we are going to miss you hugely indeed. And Kevin, you're so right about saying, you know, children and adults, putting them together. We will be here till at least 1 o'clock, if not 2. And I think, you know, we have very important areas to cover. So I'm glad you agree with what I think most of us here on the scrutiny panel think. So please keep plugging that one. I've got, thank you. Vic, I've got 3 meaty questions to ask, but we've said before, and there may be quick answers, but we've said before, there isn't a slot on education or children and young people directly on this agenda. So these are things that have occurred, are occurring at the moment, and I think we do need some answers on them. Firstly, it's the transfer to secondary schools, and it's been in the media that 84% of children got their first preferences, but I'd like to dig a little more deeply here. 77 pupils have not been offered a place at any of their preferences and have instead been offered a place at their next nearest school with a place available, which is known as a referral. So is it possible to have a breakdown of these pupils? It may not be possible now, but maybe if we could have a breakdown of these pupils, maybe Chris might be able to come in on this. Are they from any particular part of the city, particular primary schools? Maybe you might not want to identify the primary schools, but any particular part of the city. And do they relate to any particular secondary schools? Are these youngsters applying for a particular popular school and are they using up all their preferences? There are 5 preferences. Are they using all of them up? So anyhow, that is my first question. My second question is one I keep on about, as you know, is about free school meals. And now that Easter is approaching, it was really heartening to see that over the half term, the February half term, that the money for free school meal vouchers mainly was being found from the COVID Winter Fund from the government. I'm wondering what's happening about the Easter holidays as they're coming within 3 weeks. And then there's been a shocking report about poverty amongst families and especially amongst children in one of the local, in the Guardian newspaper, which said that 1 in 5 UK schools have set up a food bank and many more are giving ad hoc emergency food support to pupils and their families. Do we know, are there any schools in Baines where this is actually happening? And one of the things that the Food Poverty or Food Justice Alliance steering group set up by Baines Council is looking at is maybe mapping food poverty. And this might be one area of being able to map food poverty by looking at what schools are actually offering. And again, I know you may not have this information to hand. Maybe it's known amongst perhaps Chris Wilford or other people, or maybe you can come back to me to us about this perhaps at a later date.
Okay, very good questions there, Liz. I'll start with the first one. Obviously, our school placement teams do an exceptionally good job with finding students their first, second, sometimes third placements. You are right that there are always a number of people that aren't happy with the placements they get. And my advice is always to every counsellor is to direct those residents to the appeals process, which is normally fair and balanced and often can be successful for those parents. But Chris, you've actually preempted a question, Liz, that I was going to ask Chris in my weekly meeting, which was I would like the breakdown of exactly where those appeals are coming from and who are not getting their first preferences. So, Chris, would you like to jump in on that?
Maybe I did, yeah.
Yeah.
Councillor Harden very kindly gave me the heads up yesterday, and I passed the request, which is quite detailed about where they're coming from and how we're using all their choices, onto our admissions manager. She was on leave yesterday. She's back in this morning, so she will provide that information. If she gets it to me in the duration of this meeting, I'll pass it on via Mark. If not, I'll endeavour to get it to you at the end.
Brilliant, thanks for that, Chris.
It disappeared from the screen, Liz. Are you still there? Oh, there you are.
Yeah.
Unfortunately, I froze at the critical moment when Chris started to speak, but I heard the last sentence, which you're going to get the information to me, which is the important bit. So thank you.
And crucially, Liz, we won't just get information for information's sake. If it shows that we need to act, then we'll obviously make those changes. Okay, if it identifies a particular problem. With regards to free school meals, I fully agree with you, Liz. The COVID winter grant has virtually run out. So we are looking for support from the government again to provide, if possible, support over the Easter period. I will happily write to the Secretary of State again, and I've no doubt that there will be a national campaign from Marcus Rashford as well to pressure the Prime Minister into providing the services. It's very, very, very annoying from my perspective that the government haven't made a decision on this already, because you are spot on. It's only 3 weeks away from the Easter holidays, and we would prefer that they'd already made a decision on this. So we will keep pushing for that, Liz. The third question, Chris, we'll get that information to you. Am I speaking out of place there, Chris? Yeah, he's smiling at me, which is normally a good sign.
I literally this morning I chased the thing about the free school meals and the Easter one with Richard Morgan and the welfare team. Apparently there was in the budget announcement a very small amendment to allow local authorities carry over some of their COVID grant to the 16th of April. So we're looking at the whether that gives us the flexibility to provide the free school meals offer over the April period. We think of the Easter holidays. We think it does, which is great. And if it does, then that we've got the arrangements in place to arrange that. But Council Guy wouldn't have been aware of that because I literally just had that conversation right now. So hopefully that provides Liz with some information about that one. With regards to the food bank run, I saw that report as well. I'm not aware of the Bain School setting up a food bank. I know that schools have worked closely with food banks and directed parents towards food banks. I also know that some of our schools have, during lockdown, have been excellent in going around and delivering food parcels to families as well. But I will ask more widely to see if anyone is aware of that, but I'm not at this stage.
Thanks, Chris. I think, Liz, to add to Chris's point there, with regards to food poverty, it's crucial that we look at the causes of food poverty as well as dealing with the immediate issues. So it's something that I know Rob and I are looking at a more holistic view of the general causes of food poverty and what we can do in Baines with the third sector, with the government to tackle those issues.
Okay, Kevin.
Thank you, Vic. Just a couple of questions, please, Kevin. The first one, on the Culverhay site, have the decisions now been made, or are these just still priorities? So has anything been set in stone yet? And if they have been set in stone, then what is the impact then of that being set in stone on the wider sort of high needs provision and everything else, please? And as there's a subsequent question after that, which is not related in any way possibly to your report, apart from it mentions about some vaccinations, but this is a different type. A fellow trade union colleague did mention to me that some normal or everyday flu vaccines were being administered in schools, and by Virgin Care, I understand, and there was a mistake made, and apparently when the conversation was had with Virgin Care, other mistakes had been made about administration, whether permission had been given or not given. So again, whether this needs to be taken back and had a little thought about to see if anything has happened on this one, would be great to sort of hear what the outcome is, please.
Okay, thanks, Kevin. Second question, I'll ask officers to chase that up because I am not aware of that incident. So I will. Chris, have you got an update on that?
I've been aware of that one. I've been chasing that with Virgin to find out protocol about who's responsible for the actual administration of the vaccines on site and making sure we're clear about which children should be and which children declined. Literally had that one the other day, and I'm looking at that one with Virgin Care.
Okay, thanks for that, Chris. Yeah, with regards to your first question, Kevin, So the only thing set in stone at the moment is regards to the Heritage Department have moved into a certain section of the Culverhay site, and the Learn at Mats have agreed in principle that both their secondary and primary education will move into the Bath Spa section, which will increase their provision, which is great. And the funding for that is being sought at the moment. So that's 95% solid. With regards to the bigger picture, there has to be a bidding process and people have to come forward with set plans, i.e., for example, if there was a Bath College that wanted to provide a provision on the site, they would have to come forward with a plan. That process would take 6 months to a year to come into fruition. So those are not as solid as the AP provision. But hopefully in a year's time, once you've had some successful bids, I'll be able to report that they are far more solid than they are at the moment. If that helps.
Yes, thank you.
Thank you. Rob, you've made a request to ask a question of your colleague.
Yeah, I just really wanted to throw a bit of more information. I think the question was about food banks for in schools and everything like that. I've asked for further confirmation or information from the officers. As you know, there's been a big piece of work done by the public health team on food insecurity, and with the emergence of food pantries. Now, I believe one of our city centre primary schools have actually got a food pantry, which obviously goes to further, other needs for that particular cohort of residents. And I'll get the exact chapter and verse on that one and get it distributed to panel members. I don't know if you want me to not mention the school involved, and I won't at this stage. But I know it is something that's it's a bit sort of spearheading the work really. And the other thing that I really wanted to sort of just mention of as well is in terms of the scrutiny with adults and children being on the same panel. I certainly recognise the challenges that panel has in accommodating the range of work that comes in here. But my only comment would be is that whatever solution we arrive at, we must also bear in mind a lot of work that happens on the transitional parts with children moving into the adult service and things like this. And that has always, I think, been an area that we've struggled with. So whatever we do, we must make sure that those transition pieces of work, and they happen at various stages in people's life, we've got to make sure that we don't let anybody fall through the cracks.
Okay, Paul.
Chair, thank you. It's not a political point I'm making, but there's been a lot of talk about exam results, and I was hoping there would be something on the agenda today. With a large number of our schools being within academies or multi-academy trusts, is there any exercise of us looking to make sure, because that's a highly competitive marketplace for the schools, that we are going to get a fair set of results coming out from our schools within the area, because it is relevant to those young people going into jobs in the future and for employers.
Paul, are you referring to last September's results, or
no, the next lot of results?
Okay, yeah, not a problem. I'll work with Chris and we'll make sure that comes out in a timely fashion for you to look at.
Yeah, will it go to the school standards board? I suppose I'm asking you, Kevin, but I'm looking at Chris on the right hand side of my screen.
I think we'll have to wait to see what the DFE steers it this time. So last year they very clearly said they would not be requesting any examination data from any schools. There weren't any primary exams that took place, but they won't be requesting secondary data. Obviously, we're in a place where we've got a second year of this, and it has, as you will have seen, it has asked teachers to make the decisions on the final examinations results this time, which is different to the formula they used last time. We will wait to find out what they do in terms of asking for that information to be requested. I would be slightly surprised if the DFE didn't request that data for a second year in a row, because that would be quite a significant gap in the knowledge of what we know about children's examinations results. So if that is the steer and the DfE are requesting it, then we will be requesting it from the schools, because that gives us the backing to ask it from the academies. And we can pull that information together. What will be very difficult is to compare that against any previous information, but I would expect Spain still to be doing well, as it always has in relation to its examination results.
Chair, I understand that, but the issue that has always been with us, we used to have a lot of data provided to the committee, was about the inclusion gap at certain schools at secondary level. And I'm just asking you, Kevin, whether we perhaps could have a formal report at some stage in the future back on this, because I think it is relevant to the community.
Yeah, you want a specific report on the inclusion gap, do you, Paul? Yeah,
please.
Yeah, okay, we can do that, not a problem.
Even if it's only a virtual calculation, I think it is important for us to keep asking the question. Thank you.
Okay, so I've had a request from Michelle that, is it possible for all of us to get the answers to Liz's questions with reference to school places? So we'll all, hopefully we'll be in receipt of that. And I'm going to take the final speaker to Kevin, and that's Ruth.
I didn't ask to speak.
Oh, right, okay. So we'll bring.
Always nice to speak to you there, Ruth.
Yeah. So then, Kevin, we'll bring that to a close now. Then, so if we can, we're about a quarter of an hour behind schedule now. But it was a good bash-in that we gave Kevin, quite appropriate. So if I can move on now to invite Dr. Bryn Bird to update the panel on behalf of the Baines and the Baines Swindon Wiltshire CCG. So, Bryn.
Thank you, Chair. Good morning, panel. I'll keep it brief in light of that and assume the report as read. I just wanted to draw out a couple of things and also give an update on general COVID position in the IUH. So in the positive news on COVID numbers, the roughly the 7-day diagnosis rate is now around 30 per 100,000, and that's approximately halved in the last month. And it's around 10% of what it was at the turn of the year. To put that in some context, that's about 3/4 of the rate of the Southwest as a whole, and comfortably less than half of the national rate. So that's some positive news, being mindful that's not a message to change any of our behaviours at this stage, of course. In terms of position in the RUH, as of yesterday, there was no new diagnoses in the last previous 48 hours, and no patients on non-invasive ventilation nor deaths in the hospital. That's a positive news. There were 20 cases still present in hospital, so that clearly still having an ongoing effect, and mindful of the distancing and bed capacity around that. Moving on to the vaccinations program. So we have in Baines over 3/4 of the cohort population vaccinated. That's 1 to 9. So that's very positive, and we're looking at increasing the rate over this coming month in line with national increase in vaccination delivery. That's roughly equivocal across the whole of BSW. A few percentage points ahead in terms of vaccinations of cohorts 1 to 9, and it's approximately 350,000 vaccinations across all of Baines, Swindon and Wiltshire. I haven't got that exact figure to hand specifically for Baines. In terms of the programme as a whole, there's been a lot of churn created around things like the Q COVID programme, which is putting people into different cohorts, as well as changes to carer status and different conditions. but on the whole, we're still on schedule and doing a lot of work to help deliver that program effectively. We're moving on to second doses soon, so that will represent its own challenges as well, but notwithstanding, that's understood in how it's going to affect future delivery. And we're also looking at where it's delivered as well, between the primary care network delivery sites alongside the mass vaccination sites. So these are conversations we're having, bearing in mind some of these mass vaccination sites will have to potentially be carrying out business as usual in the future. Last thing I just wanted to bring out in the report was around the creation of the ICFs from the white paper. So the white paper alludes to an NHS statutory body working alongside a health and care partnership. And that representation will be across the whole of BSW. However, the details and what partnership looks like across BANES is still in development, and there's active conversations taking place around that to ensure we maximise the potential in the model of integration. So this is integration across primary, community and secondary care, mental and physical health and social care, with the aim of improving outcomes across a range of areas, including inequalities, quality of care and productivity. So that's certainly ongoing work and an exciting part of what we're working on in the commissioning side over the coming year. Alongside that sits what we call the new hospital programme, but I believe we're having an update on that later, so I'm happy to just take questions on that if there are any. I'll leave it there. Thank you, Chair.
Thank you. Jess.
Thank you, and thank you for the update. I had a couple of questions. The first one was about the update about the government's white paper on integrated care systems. And I certainly find a lot of the language and structural changes quite difficult to understand and picture. So as you're having the kind of partnership discussions and looking at how things work, if you're able to map it out for us and perhaps, you know, before firm decisions are made so that we can understand our scrutiny role within that, that would be really helpful. And then one aspect I wanted to ask particularly about was where you're listing the proposals in the white paper. The second point says that the proposed reforms will give commissioners greater flexibility in how they arrange services. Would you be able to sort of say a bit more about what that will practically mean for services in Bath and North East Somerset, or what it could mean? And then my second specific question was about long COVID and the service that's mentioned there. I just wondered if that service has a physical base and where that is.
Certainly. Thank you for those. So the first one was more a request, I understand, over the coming year, perhaps to elaborate and spell out what the white paper may mean to the panel. I'm very happy to do that going forward. The second part was around that flexibility. So one of the key elements of this is commissioning, as we've understood it for the past 9 years, has been done away with, notwithstanding that some of that function still needs to exist. But one of the key elements is doing away with that sort of purchase provider split, which has in the past 9 years created some siloed forms of working, and due to things like contracts and the procurement process and what's been awarded, that reduces, I'd say, the flexibility to work across the system in the areas I was alluding to, take between primary care, community care and secondary care, to be flexible in where the care is delivered beyond those contracts. So, we're still in the detail phase, but the overall long-term aim is in potentially 5 years' time, as healthcare model develops, we have the flexibility as a system in health and social care to be able to quickly deliver it in other places. But if it's the right thing to do for patients in terms of quality care and efficiencies. So that's where I really see some of the advantage in that taking place if we get the care model and the buy-in across the system correct. I'm very happy to bring sort of more detail, as you say, Jessica. I think this can be quite elusive to a lot of people that aren't closely involved in the detail. And I think it's a very important thing to understand beyond some of what people would consider jargon, and put some real life examples to that. So I'm happy to come up with something like that in future if that's helpful for you.
Helpful, yeah.
Yeah. The third one was around the base to the long COVID ward. Yeah. So it's based. So it's led by Wiltshire Health and Care that will do the initial triage service. As an example of us working across the previous branch, working together as one CCG and pooling that resource. That's not to say that once Wiltshire Health and Care have done the triage process, then the services that are used beyond that can be more local, so coming out of the IUH or community services within Baines. But that initial hub, if you like, is taking place in Wiltshire Health and Care. But it's remote anyway, so it's sort of a virtual hub, but not particularly a physical one as much.
Yeah, thank you.
Thanks, Bryn. The integrated care systems, we've had integrated care in Baines since I think 2009. And it's different interpretations, and it seems taking a lay approach as though it's a duplication of all what we already do. I appreciate it's not. So certainly further updates on how that develops would be appreciated.
Thank you,
Liz.
Sorry, thank you. I was just unmuting myself. I think Vic, you've just probably answered my question for Dr. Bryn, and Jess also mentioned what my question was going to be, and I think I've had it answered, and that we're looking at the integrated care system and the proposals in the white paper. I wasn't really very clear about it, and I was wondering about. There's talk about place-based arrangements. Now, from what you said, Dr. Bryn, I think you're mentioning that this is a model that's in the process of being worked out. So is it a bit preemptive to say, well, what do you mean by place-based arrangements, or is this going to become clearer in the fullness of time?
Yeah, I think I wouldn't really go into details at this stage because it's, as you say, it's still being worked out, and perhaps to give an example might draw people down the wrong path. But I think the important thing to note in terms of place-based partnerships is that leaderships from teams are already, as we have been for the past year plus, working together to sort of redesign our health and care services so they're more appropriate for the next 10, 20, 30 years in terms of quality of care, patient experience, efficiencies, as well as workforce inequality. So that includes leadership from the IUH, from Virgin Care, from primary care, from ourselves in commissioning, social care, mental health, and voluntary sector, to name but a few. So those people are involved in these conversations to create that, bearing in mind we need what we call, not to use jargon, but a biopsychosocial model, reflecting that there's more than just a traditional sort of medical model that's required moving forward. And also in light of areas that have been catalysed by COVID, but were trends that were taking place already, such as how to remote monitor patients, the use of digital in patients' experience of their service, and access to their records, to name but a few areas. So it's understanding those things and how they're going to influence the health and care model moving forward. Liz, I think it's the important thing to understand at this stage. And it's, I suppose, if we just reflect on some of the things, the reports such as long COVID or the COVID oximetry at home that we've discussed on this panel previously, that's a reasonable example of different parts of the system sort of overlooking their contractual obligations to come together for the benefit of the patient experience, which has had some urgency, as you can understand, over managing COVID patients, keeping them at a hospital and giving them the best possible care. So there are things you can draw at, but I think the best thing is to update this panel on the developments as they take place from there.
Okay, thank you. Paul May.
Thank you. Bryn, I think your and the chair's comments about we've got integrated care in this area actually mask what I think are some of the key issues for us moving forward. Because if you go down a statutory body that's picking up health and care together, there's a great risk that the democratic influence that we have as a council over the care side might actually be taken away from the local authority, and that the creation of a statutory body may mean that the CCGs actually disappear. And the fact that we had, after the last reorganisation, the creation of the public health role back into local government, I think that could come under threat. So I think we've got to be really careful not to say, oh, we've done it, because I think that there may well be statutory changes which actually put us all under some threat moving forward. And in particular, we've got a large contract with Virgin, which is not about partnership, it's about contracted work being carried out for the community. And I think there's a whole range of issues that we're going to have to be really careful about moving forward.
Thank you, Councillors. A couple of points to pick up on that. I suppose firstly picking up on Virgin, that's a reasonable example of the evolution, and Virgin are a very present part of these conversations. And you know, we understand as a system, as I alluded to at the start, that sticking to the contract and working just as a community service separate from primary care and the acute isn't necessarily going to be the model we want in 10 years' time for the joined up working that a patient needs and the right care in the right place, things we understand but are hard in the current model. And that will mean the evolution of Virgin services in the next 5 to 10 years, bearing in mind their current contractual obligations, but they understand they need to be part of the process and they are doing that. If I can pick up on the second point you're making, alluding to Vic's comments, we already have integration. I suppose that's why I mentioned a couple of points when I was giving the presentation. Integration does mean a lot of things, doesn't it? And I think Vic was alluding to health and social care, which is a good example early on. It certainly has been a good example of where nationally the direction is heading and where hopefully we aim to build on locally as well, of course. But as I said, that's what, and we need greater integration in mental and physical health. So our mental health services need to be part of these conversations. So designing a service around a patient perhaps potentially needs to incorporate a mental health approach alongside a physical health approach. And as I said as well, primary, community, secondary care services alongside voluntary sector, those teams working together recognises that specialist services aren't just done on one site in Bath. Primary care services aren't just in a GP practice, and the volunteer sector sort of hovers around that. We need earlier intervention in patient care. We need care closer to home, and we need the integration and understanding of how those services are delivered. So there's the expertise and the leftward shift of models sort of outside of the hospital. So that, that's just one example of many we could go into of what integration could mean.
So Bryn, in very simplistic terms, what the integration is a more comprehensive integration rather than, as we're exercising at present, just health and social care. I went some years ago to the LGA and they were talking about integration there of health and adult social care. And I couldn't understand it because we've been doing it for years. We were national leaders. And of course, I think that the objective probably is to get the remainder of the country and all of us exactly the same on the interpretation of integrated services. So
yeah, I came from Kent, from Understanding Commissioning Services there in 2017, 2018, and I was dropped into Baines and couldn't believe my eyes. This is what we'd been trying to work on and not achieve by the time I left for a good couple of years prior to that. I was like, here it is, excellent. So, hopefully we can recognise that and continue to develop that alongside these changes, legislative changes.
So I'm going to give you one more final person to present questions to, Bryn, and that's Kevin.
Thank you, Vic. Bryn, you've mentioned flexibility as being one of the, possibly, if I've got it understood correctly, the key benefits of this integrated system. Are there any costs, or are there any more key benefits that you can see at this stage?
I think the costs have to be, in some ways, it's the leadership that are also running the service. That's the key difference, isn't it? We're doing away with the purchaser provider split, that traditional procurement function of commissioning. So the leadership team are also the ones running the services. So we have to be mindful of that. And that's where the statutory body comes in to an extent to keep some of that regulation and appraisal function. So as we develop, I think it's important to recognise that as a risk. I think we've sort of attached this word flexibility, haven't we, in terms of the benefits. I think potentially they should be quite great. I think a lot of the panel recognise that doing high cost services reactively in a hospital is not particularly fit for purposes we move forward with the demographic changes we're facing over the next 20 years. So I would expect that quality of care, quality of patient outcomes is a really important area that can be addressed by using this system far better, because the way we've approached it previously is that the hospital will achieve certain goals, the community will achieve certain goals, primary care will achieve certain goals. That doesn't necessarily equal patient outcomes. So it's a different approach to how we deliver that. And we use analytics for that in terms of the potential benefit of creating a change within our system, which isn't easy. Obviously, there's a lot of understanding and a process to go through there, but it's a different way of working at understanding care that's about delivering better outcomes sooner for our patients, and early in their journey rather than reacting to when they become infirm. So there's much greater opportunity for prevention, I would say. And that involves a voluntary service as well, as a big part of that, in my opinion.
Thank you very much.
Okay, so we'll bring matters to a close there. Thank you very much, Bryn.
Okay.
So we'll move on to item 9, the Virgin Care Commissioner 6-month update reports. And if I can invite Leslie Husserton and Claire Thorogood to present the report, please.
Thank you, Councillor Pritchard. So I'd like to, you've met myself, and obviously we've got Claire Thorogood with us. Claire, do you want to introduce yourself?
Good morning, everybody. It's Claire Thorogood here. I'm the Head of Contracting and Performance, and I lead on the Virgin Care contract on behalf of Baines Council and BSWCCG.
So Claire and I will be doing a double act this morning in terms of presenting this report, but just by way of introduction to it, you've obviously had a couple of reports now to the panel. We're bringing them every 6 months, and this will be the third of its type. You asked us specifically at the last panel meeting to focus on the reablement service and on the financial performance, and that's what we're doing today. But we brought you some additional information in relation to the work that Virgin Care have been doing during the rest of the COVID period since the last report, and then we've just brought you a bit of information at the end in terms of performance, and then a quick note on the contract and the contract extension. We've also got our colleague Joe Scammell with us today, who's also on this call should there be any more detailed questions. And if you'd permit, we would, if you'd permit, and if there are any more detailed questions, we'll get Joe to come in and just answer those if needed. So you're asked to just note the report, but before we make a start on the full detail of it, I just wanted to inform the panel that at the beginning of the COVID period, the government brought in the potential for council to enact Care Act easements. But from a local authority perspective, I just wanted to confirm that we haven't enacted any easements outside of the social distancing arrangements, and that's to everybody's credit, but not least to Virgin's in terms of the way they've been managed some of that social work service and some of the directly delivered services. If I go onto the main body of the report, so obviously the Virgin contract is a joint contract, as you know, with the Clinical Council and the Clinical Commissioning Group. So we've got both health and social care content in this report, as you'd expect. If I start with reablement, we've just been talking about our integrated arrangements, haven't we? Well, the reablement service is a prime example of one of those integrated services. It's an integrated reablement service that's been in place for many years, but that Virgin, as part of the transformation agenda, have taken on now in full and are developing. It's been particularly crucial in terms of our helping to support people that are discharged from hospital. And you can see throughout the report the increase in activity and the increase in pressures that have been placed on that service. But before I go into detail, just for those of you that don't know, reablement is actually a short-term assessment and support service which takes place in people's own homes, usually their place of residence, and it lasts for up to 6 weeks. And that's what guidance tells us. It's up to 6 weeks. It doesn't mean that people have it for 6 weeks. It means they have it for the period of time that they need it for, which could be 2 weeks, could be 3 weeks, and very occasionally it goes on beyond the 6 week period. But it's to help the person become as optimum as possible, to help them remain independent. And it's a service that moves in very swiftly. It comes in straight away, and it's got kind of three functions, if you like, three key referral. One is around admission avoidance, and that's very much a crisis response to try and help people keep fit and well and stop them coming into hospital, but do a bit of work to try and prevent them coming in. The second is to help facilitate hospital discharges, and that's been primary. Both of those elements have been really primary in terms of the COVID period. So that is when people are ready, they're clinically fit and no longer need to reside in hospital. And that's the term that we're using, criteria to reside at the moment. It's placed our delayed transfers of care arrangements. But when people are fit, no longer need the support of the clinicians in the hospital, then the reablement team comes in and helps people, those that are ready and need reablement, I hasten to add, it helps them to move home quickly, and then therapists come in to support that person while at home to try and get them back onto their feet as quickly as possible and to be independent. So that's the second part of the work stream, if you like. And then the third part, crucial point, is for helping those people in the community. So to kind of catch people before they get into that crisis point, and to help them continue to have strong skills so that they don't need to go into hospital. So it's a bit of that admission avoidance piece, but it's doing that within it's kind of a preventative mechanism rather than that crisis response bit. So it's an integrated service, and it's made up of a range of different professionals: occupational therapists, physiotherapists, and reablement support workers. And you can tell from the report there's quite a big staff team, and it's jointly funded from the CCG and the council, monies that are pooled within what's called the Better Care Fund. Virgin took on the service in full, I think it was from the end of this financial year, and we transitioned and tupied over some of the reablement workers that were in different organisations under the umbrella of Virgin, so that they could have greater control over that service to help meet the transformation agenda. And they're working through a new reablement model at the moment, some of which is detailed on page 34 of your report. One of the key things that's happening and that we're putting in place is that they're delivering a robust check at the 2 week point, the 2 week assessment point for when people are going through the service. Doesn't mean that the service stops at 2 weeks, and we've been very clear about that. Everybody's on the same page, but it does just mean that everybody's taking stock at that 2 week point. So staff transferred over to Virgin Care. It was December 2020 when the staff came over from the three other services, some of which you'll be familiar with as they were part of our strategic partnership many, many years ago. Doesn't mean that we still don't have a relationship with those strategic partners, because they still offer the home care services, but the reablement element has come over to Virgin. There's been a steering group in place for a couple of years now, since October 2018, and the contract was varied for Virgin Care in order to take full delivery of the service, and it goes live on the 1st of April 2021. As you can see under 2.4, which is on page 35 of this report, there has been a huge increase in the activity of that service since COVID came in, as you'd expect, particularly helping people come out of hospital. And additional funding has been given by the CCG, which has been given from national government to help Virgin Care. It was called through their winter pressures money and some other funding before, to help Virgin Care try and recruit additional staffing. And I know, Councillor Harman, you've already asked some questions in terms of how are we going to recruit those additional staffing when there is such a national shortage. And it is a national problem. You're absolutely, it is a national problem, and it's one that everybody is trying to work on together. But Virgin will give an additional funding to try and support that increase in activity. And despite the increase in activity, you can see that they're managing to, in terms of their performance, to hit the performance target of around 85%. They're managing well with that to make sure the number of that people remain in the service and are reablement within the fixed time period that we've got. So they've done well with that. You can see under section 2.7 the next steps for this service, and they've laid those out for the year above. But in short, it has been, I think it's fair to say that it's been a difficult, getting people out of hospital during this COVID period has been difficult, and it's been a primary focus, and it hasn't been an easy thing for the service. So we've had to buy in additional support through other providers to try and help with the flow. But Virgin have been doing their best to try and keep on top of that. I'm going to move on to Claire now in terms of talking about the finances.
Thank you, Les. So for panel to note, this of course builds upon the previous two finance sections that we've delivered in the March and September update to scrutiny panel of last year. We are currently in year 4 of the Virgin Care contract term of the first 7 years. And this year, Virgin Care have received a total income of approximately 56 million from the council and the CCG for the delivery of the community healthcare and social care. The original bid has been noted previously in panel reports, did actually plan for losses on the basis of transformation and investment back into services. It should be noted, though, that with regards to the council funded services within the contract, this is what we refer to as a flat cash funded profile. So there's no inflationary uplift for the provider. It's a fixed profile of funding. In contract year 2, which was 2018 and 19, the contract was 1.4 million overspent. And in year 3, so contract year 2019-20, the overspend was 0.7 million. What Les and I would like to draw panel's attention to is the significant improvement that Virgin Care have made as a provider for the end of the financial forecast for contract year 4, which is an overspend of 0.3 million. So we can clearly demonstrate there's a closing of the gap. It's well noted and documented. This year for all of us has been dominated by the impact of COVID and managing the pandemic, and Virgin as a provider have received some additional financial support from the NHS to support services, and that's been through the BSW CCG, and the council have also supported Virgin with regards to funding for the pump prime of the community wellbeing hub, and that has now been secured for an additional 18 months with existing Virgin Care funds and council resources and some third-party funding. And later on in the report, I will give panel a closer overview of the activity and performance of the wellbeing hub over the last year. The other thing Les and I would like for panel to note is how well and strategically Virgin Care have supported the council through the financial savings and through close collaboration and partnership working. Virgin Care have worked with us to deliver savings of 1.2 million, and that's been through some of the panel savings and proactive engagement. And of course, what we are also working on is additional activity through transformation and changes to the supported living service, which will happen further on into next year, and that will concentrate about bringing placements back into the Baines area and will lead to future reduces in expenditure. So that's the brief financial update for today. I will hand back over to Les now, who will carry on with performance and service overviews.
Thank you, Claire. So you hadn't asked this time for information on performance, but we thought it was prudent to put some information in because it had been 6 months. I don't plan to go into this in any detail. You can certainly ask questions and we will do our best to answer. But what we've demonstrated is some good performance, but we've also got there are obviously some areas of concern that I'm sure panel might want to pick up on at the question point of the report. You can see that it was more difficult during wave 2 for Virgin to redeploy some of the staff, which they've been able to do in wave 1, which has been a challenge, and Virgin have been trying. We regularly routinely talk about workforce and how well the workforce are, and whether they can get in agency staff, and they have been really trying to get in agency staff like the majority of health and social care providers to keep services going. And it has been a struggle. That's not just for Virgin, but that's been for everybody. And we're hoping, obviously, now that things will calm down with the vaccine in place. But you can see that despite the challenges that they've had, that in some areas of performance, they've done particularly well, better than the national and the CCG expected averages in some of the community health services. But there's also been particular areas where that's been problematic, such as audiology performance. We've included some bits of innovation in terms of the work that Virgin have been doing for outpatients, because I thought that was quite a nice display of the types of things that have been happening to show how flexible providers, particularly Virgin in this instance, have been being to try and keep services going, and it's important to see that. And obviously for children's health services, the impact has been different in terms of those for adults. So you can see a little bit of information there, and then we've included, as I said at the beginning, we haven't enacted any of the Care Act easements, but we've got some information on adult social care's performance, because I think that's particularly important for you to see as well. And whilst you can see that the number of people waiting for a social care assessment has increased, what I hasten to add is that everybody coming into that service needing an assessment, that's for the full Care Act assessment where you're seeing those numbers, but that doesn't mean that people haven't been seen, that short-term support has been offered, so that we know that those people aren't sitting in crisis. So people are reprioritised and prioritised every day. So I'm not concerned that people are left waiting without a service in that sense. But what that shows you is that the full Care Act assessment hasn't been done. And similarly with OTs, there's kind of 2 priorities for occupational therapist appointments. And in the priority 1 group, that's that real crisis group, there's nobody waiting for that. And the priority 2 group are constantly being reprioritised. And then reviews, that's been an area where we've had to make a decision about where do you focus your efforts. Because for me, the people that we need to focus on efforts are the people that we don't know what their needs are, where we're doing the assessments, which has meant that the review performance has dipped. And it is something that will be the focus when the COVID period's over. That will certainly be the focus to see. We want to see that starting to improve, because it's not a place where the Commissioner or Virgin want to be. And it had started to improve again in the January. But what we've had to do, because of the second wave that came in just before Christmas, we've had to prioritise people that live out of area and that have got a level of need that puts them in a priority above people that are stable with their care and support plans. And the reason we've gone for people that are out of area is because we don't have that direct contact with those providers on a day-to-day basis like we are doing right now with providers throughout the commissioners are in constant conversation with providers. So it felt like they were the main areas that we needed to focus on. I mentioned briefly in terms of the timeliness of hospital discharges. Obviously, as I mentioned before, the delayed transfers of care performance figures that we used to capture have now been replaced by a criteria to reside. The metrics for that still haven't been published by the government, and we're waiting for that. But nevertheless, what we have on a weekly, daily basis is what's called a flow meeting, where anybody that's in the hospital that is ready to be discharged, then the staff working around that meet on a regular basis to make sure that people aren't staying in hospital for longer than they need to. And all parties are working in a very integrated and collaborative way with that. So there'll be more information on that when the criteria comes out and the metrics can be measured. So I'll move on to Claire for the Wellbeing Hub update.
Thank you, Les. So with regards to the Community Wellbeing Hub, I thought it appropriate and prudent to update panel on some of the activity. We are approaching the year 1 anniversary on the 23rd of March. And as you know, this service was set up as a new service very, very quickly in response to COVID back in March 2020. So since the end of March of last year, up until the midpoint of February, the service has actually supported over 11,700 calls into the triage team. And that triage team is staffed through Virgin Care's team. Crucially, 69% of the calls are actually resolved at the point of triage. So I think that goes to show just how significant the level of support and understanding that the team that Virgin Care have deployed into that service demonstrate. As you know, we work very, very closely with 3SG, so our partner organisation for volunteering across BAMES. And 3SG have substantially engaged a number of volunteers, over 2,000 volunteers through this period. And those volunteers have actually delivered 3,500 individual volunteering tasks, and 174 residents in BAMES are supported either weekly or 2 weekly intervals, with the highest amount of support goes for food, and there's also support for medications and other forms of support, whether that be some befriending or support with top-up of utilities. So whatever that person needs, if they are self-isolating or shielding, we have a team of volunteers on the ground. And crucially, when it comes to food shopping, that team of volunteers has actually undertaken nearly £80,000 worth of food shopping on behalf of residents in BAMES. The council have a pod. So within the hub, we do have a pod, and that is led by the council's community engagement team. And specifically, that pod undertakes some food logistics work. So some of the activity over the last year has included the distribution of 640 emergency food parcels across BAMES. And we do have some repeat activity within that food delivery. However, Virgin Care nutritionists and wellness staff are on hand as well to make sure that we are not building up dependency, that we're actually supporting those individuals or family to have long-term sustainable solutions at the same time. In addition to the emergency food parcels that are issued, the team have worked incredibly hard with key community partners, for example, the Bath Masonic Hall Trust and Square Meals Project. And thanks to the funding of those projects, that's actually now secure up until April of this year, we've actually now issued 38,000 frozen meals to some of the most vulnerable individuals and families across BAMES. And that is a significant amount of support that those individuals are getting. And just for panel to note, when it comes to the frozen meals, 6,000 were supplied by the Ivy Restaurant for children's, and the 32,000 were supplied by the Square Meals Project. So that's significant investment from our community partners. The other key piece of work in terms of the council role within the Community Wellbeing Hub is leading on the council's statutory responsibility for supporting the clinically extremely vulnerable. And through lockdown 2, so back in October, and then lockdown 3, which commenced in the January term, the hub leads on making sure that we as a local authority discharge our duty appropriately to support those individuals. So we have what we call a shielded patient list, which is updated on a regular basis, and that lists all of the individuals in BAMES or any local authority area that are deemed to be clinically extremely vulnerable. Now, at the start of lockdown 3 in January, that list was about 6,500 individuals across BAMES. And what we do as a council is every time we move into a lockdown scenario, we write to those individuals, and that's either lands by post or via email, to make sure that we are always supporting those individuals to the additional support, advice and guidance that's available to them through the hub. So they are asked to register on a national shielding system any support need that they have. That is then fed through to the hub and the team of individuals. And again, my thanks to the triage team at Virgin Care that do additional welfare checks on those individuals. And we supported 128 individuals at the time of the report. That's now increased to 154. Now, what's also happened during lockdown 3 is the government decided to change the risk matrix for clinically extremely vulnerable, and through research decided to include additional groups into that category. So we did actually inherit into BAMES an additional 3,000 clinically extremely vulnerable individuals. And again, the same process has been followed up, where in the last 2 weeks, each of those individuals has been sent a letter, again, signposting those individuals to the correct support. The other thing the community engagement team have started to do as part of the work of the hub is put together a suite of webinars, and they've been incredibly well received. The first was held on I do believe the 19th of February for the vaccination, to make sure that people understand the route by vaccination, the frameworks, the cohorts, the prioritisation, and how the vaccination programme works, and that was incredibly well received. I must note, panel, there's one error from me in the report. I've put down on the drop-down list that the clinically extremely vulnerable webinar is actually held on the 4th. It's not, it's being held this evening. And that's actually being hosted by our council leader. Councillor Rob Appleyard is there to speak as well. We have a service user that's CEV that uses the services of the hub, Joanna Scammell, who's the senior leader from Virgin Care, Kate Morton, the CEO of Bathmind, and other keynote speakers. And I've just been alerted, actually, I think this is significant. We have over 100 delegates that have booked onto that webinar. So I think that just goes to show the depth and breadth and reach that we've managed to achieve through this partnership work, and of making sure the most vulnerable have the support that they need. So on behalf of all of the partners of the Community Wellbeing Hub, I think that just goes to show some high level activity of what we've managed to achieve in the last year. I will move on to contract extension, because that's my part of the delivery as well for panel. And it's to say that we've noted previously that the Virgin Care contract is a 7-year term plus option to extend for 3 years. And we are about to enter year 5. So we are in the last 2 weeks of year 4 of the contract. And as we term onto the 1st of April, we will be entering year 5. So that will signify the last 3 years of delivery of the first 7-year term. Of course, we will be going through a process. And I know it's one of the questions that Councillor Hardman requested that we answer. So there is no date yet set for informing of the decision about whether to extend for the 3 years or not. But what we are doing with BSW, CCG, and of course the council, is going through the routes for that decision-making process. But contractually, what's important for panel to note is that that decision must be made and formally notified to the provider no later than March 22. So we have a year, and that is the contractual term that's within the current contract. So that's the very brief update for contract extension. And it was just to round off, I'm sure there's questions. I've seen many councillors say, may I speak? So I think we're about to enter some Q&A session. But in terms of conclusion from the former element of the report, on behalf of Les and I, our thanks to Virgin colleagues as well for providing necessary information and input. And what we think is appropriate for the scrutiny panel in 6 months' time is a focus on workforce update and service user feedback. And with panel support, I think that should be the key focus, which I will work on with the new interim arrangements. Thank you very much.
Thank you, Claire and Les. So I'm going to call Kevin first, please.
Thank you, Vic. Forgive my naivety, Les and Claire, as possibly with unlike the other councillors who may have come across this topic in different areas, I only get to see sort of various things about this when it comes up. I suppose my brain gets a little bit fogged because you've put such a lot of work and effort into producing the report, and it is very detailed. And very kindly, last time, Leslie, you set out when I said, well, what are the key areas of your focus or concern? I mean, it might not be a concern, but certainly your areas of focus for the next period. And in October, you set out the delayed transfers from community hospital, occupational therapist, health assessments, annual social care, referral to treatment time, and 6-week diagnostic standard. And I suppose what I'm trying to say really is, could you sort of, when you do the performance report, if we could just have 1-2 sentences on overall, because overall it seems a rosy picture, and if that's what you're trying to tell us, if I've understood that right, I mean, they seem to be doing well given all the things that have been thrown at them, and I suppose as a panel member, I just like to know, well, are they doing a good job, do you think, overall, and where are the areas of concern, and are they addressing those areas of concern and moving things forward, which they seem to be from bits that I've been picking up, but I'd really like your expert opinion on that, please.
So if I just come in there, in terms of the delayed transfers of care, there is a section on the report that specifically looks at that, which is the section on page, there's a couple of sentences there, look where it says timeliness of hospital discharges, page 43 of your report. And that's the delayed transfers of care, which is the performance that's not currently measured in terms of the metrics, because that no longer exists. It's been replaced by the criteria to reside, and that metrics hasn't been developed. But what I would say is that, so we can't tell you how good or less good that Virgin are performing in terms of that. But what I can tell you is that obviously getting people out of discharge from hospital safely and to the right place with the right support has been one of the primary areas of focus for the COVID period, to make sure that we've got enough beds for people that are really poorly. So if people are well enough not to be in hospital, then that's been one of our key areas that across with CCG and all stakeholders, we've been focusing on that. So it's difficult to tell you exactly how well in comparison to nationally, but I can tell you that that has been a key area of focus. When that metrics comes out, we'll be able to give you that information. In terms of occupational health, occupational therapist health assessments, you can see that's just above that page. Kevin, it's just above there on page 43. And I talked about the fact that we've got priority 1 and priority 2 groups. And you can see if you go on to page 42, we've got nobody waiting that's in the priority 1 group, which I wouldn't expect to see. I wouldn't want nobody waiting there, but we've got 94 people waiting. And you can see that trend line where you can see that it's not got the months on it. It might be helpful for you to see the trend line with months on it, I think, going forward, because then you can see how it's performing. And you can see that it's slightly increased. So I think there is more work to do actually in terms of that trend column, if you like, on page 42 going forward. But the information is there, and you can see that we had more people waiting quite early on. It went even higher. Then we managed to get really low numbers. I can't say the exact number, I'm afraid, for priority 2 group. And then it's gone up again during this COVID and has now started to come back down again. And in terms of adult social care, I talked a bit around the social care assessments and the fact that we've got the 61 people waiting, but that everybody has been seen for a short-term support. And I talked a bit about the reviews, which is also referenced on page 42 and 43. Now, the referral to treatment time, I don't, and I might have this wrong, so I don't want to give you the wrong information. I need to go away and check it. But I don't think the referral to treatment time has been being collected because the NHS didn't collect a lot of the performance indicators while COVID's been taking place. But I do need to go and check that for you. And then the 6-week diagnostic. I think there is reference to the 6-week diagnostic though. Just trying to look for the right page where that is. I can't quite see it. Oh, there you go. So page 40, let me see what it says. It says performance for the percentage of people waiting over 6 weeks for diagnostic testing has been significantly challenged since the first wave of COVID-19, prior to which a 1% target was being achieved. Whilst performance saw some recovery as services reopened in the summer, since November 2020, the rate has been rising away from the national picture. And there you can see at the bottom, on page 40, you can see that trajectory has gone up, and then it improved again, and now it looks like it was going up again, but I'm not 100% sure. Oh, January 2021, that's what I would have said. So the information's there. What I'm wondering though is if you want it presented in a slightly different way that might make it more accessible. Is that what you're asking, really?
Well, I suppose so, Leslie, in the sense that, I mean, say again, from a very layperson's perspective, you very kindly said in that October time, just listed your 6 areas or 5 areas of concern and focus, and whether they green, red, yellow, got better, not thing, and an overall statement. So overall, I'm hearing that you think it's good, although there's a lot of things because of COVID that have just come in as left balls all over the place. But if you think overall they're doing great, that would be a lovely sort of starter sentence. And then these are still the areas of concern we're focusing on. That's all. I it's great having the detail. It's fantastic listening to you, because when you explained it just now, going through with your colleague, I could hear both of you. It made sense, but you reading it, it just becomes a bit difficult. That's all.
Okay, well, we'll think about presenting in a different way. I think, and when you commission an organisation, you want the organisation to perform to the targets that you've agreed with them. So it's not easy to say this is all great when you're not hitting the targets that you've already set. So as commissioners, we always want more, I'm afraid. But we have to accept that during COVID, everybody's been prioritising things in a different way. And we've had to take some difficult decisions, actually, Kevin, and we've had to work with the CCG colleagues and with all partners to look at those difficult decisions. But yes, we can do something. I'll do a statement for you afterwards, or my colleague Alison will do a statement now that she's in post.
Thank you. And it must be very difficult because that's COVID's going to throw everything off, isn't it? Thank you.
It is, and I think it's really important to us to keep a balanced view on that, because everybody, there are some things that's happened that aren't measurable in the way that some of the targets are measurable. So we do need to keep a really clear balance about what's been achieved above and beyond what is set within the terms of the contract.
Okay, then. So we'll have Liz now, please.
Hi, Vicky, you'll be very pleased to know that because I sent my questions in advance to Leslie and Claire, they've now answered most of them, but I might have missed this one, and I just wanted to go a little bit deeper, and it's page 36, paragraph 2.5. You may have answered this, in which case I apologize, I missed it, but it's wondering how and why which care homes were identified for additional care home support reablement workers. How were they chosen? Was there a particular criteria for these?
So I actually need to bring in another person on the call actually for that, because I don't know the criteria for how they were chosen. There were 10 care homes in total. I wasn't proposing to give you the list of those homes unless you would like that separately, but wasn't proposing to say who they actually were on the call today. But if I've got my colleague Judith Westcott on the call, she might be able to help with the answer on how they were chosen. Just let me check if she's on the call, and I'm putting her on the spot a bit here. Judith, are you able to answer? Don't worry if you can't, because we can get the reply.
Sorry, can you just repeat the question? I've only just come in onto the call. Thank you.
Sorry, it was the Councillor Hardman's just asked, when we identified the care homes where we were putting in the additional D2A support, reablement support, what was the criteria that you used to go about that? Don't worry if you can't answer, because we can pick it up later.
No, it was largely to do with their capacity to meet the need going forward. So obviously what we needed to know was that the care home was able to offer that different kind of provision, which was a reabling ethos, not about, staying in the home. So we have ongoing contract meetings with the home. So we know the ones which maybe had a different skill set, or the staff who might have the OT support or different kinds of skill set to take that forward. And what we did was we were sent out a specification to all of them to actually tell us how they might meet that need. And so it was a, if you like, it was an interactive process between us and them to see which ones thought they might be able to meet the need and our knowledge about them.
So I think it was, as Judith said, it was about staffing, as well as the skill set, it was about staffing availability and capacity, I think, as well, wasn't it?
Well, yes. I mean, that's certainly been one of the things throughout the pandemic. We've at the points had 14 homes closed. At some points, it's been 7 homes down to 0 homes, and so obviously it's also had to be about their ability to offer that service during that time as well.
Okay, thank you. So I'll call Alison now, please.
Thank you. Right, yes, there's a huge amount of information there, and I've just got a few questions. A couple relate to reablement. And the first one is just to check whether the service is free or if it's means tested. So that's a quick one.
The service is free for the first 6 weeks.
Thank you. Thanks.
Well, the reablement service actually is free regardless, but yeah, and you'll be familiar. The discharge to assess process was that services were free, certainly in the scheme too. Services were free for everybody discharged from hospital for the first 6 weeks. Where there was an existing package in place, it was when there was a top up on top of that that bit was free.
Mm-hmm. You did, just to interrupt there, Les, you did say that the first 6 weeks is free. You did say that by exception, there are instances where people can stray over the 6 weeks. Would they have to pay for that additional service?
No, my understanding, and I'm using that, my understanding is that they don't have to, they're not charged, they're not under the financial and charging assessment framework if it's slightly over.
Thank you. Sorry to interrupt, Alison.
No, it's all right. Well, sorry, I'm sorry, Alison, as well.
Okay, and then I've got a slightly more complicated question in relation to reablement, and that's just about how much confidence there is that the new reablement model will have sufficient impact on the number of people needing long-term care to deliver the savings programme, and how is that going to be monitored? Because that sounds like a bit of a leap of faith to me.
There is the steering group in place, Alison. I don't know what the exact metrics are that are being, the exact key performance indicators that are being used to monitor the service, but the steering group will be on top of that. It's one of the areas, because it's one of the transformation programmes that Virgin Care have got in focus. It's one of the areas that comes under that transformation agenda. So the steering group will find that particularly important to keep on top of that and how it is performing. There's a large investment, as you can see, in that service. And we need to make sure that that service is working to its optimum level. So I have suggested actually for the directorate plan for this year is that we need to do an additional piece of work, obviously helping Virgin keep on top of it in terms of the monitoring, but I just wanted to keep a grip on that really. It's one of the specific areas, and I think everybody wants that, CCG colleagues as well. So I think it's just going to be a case of keeping a watch on it. Mm-hmm. We can bring a further update for you if you like to the next. I mean, I know Claire's came in at the end and said we were recommending a deeper dive on workforce and service user feedback, but if you want a section particularly on that update on that, we can provide that as well, because then it will have given the service particularly 6 months in terms to bed itself in as well.
Yeah, that was going to be my next question, whether we could be kept updated on that.
Yeah.
And then I've got a few questions on the performance. I don't know if I should come back to those later or if you want those now.
No, do it now, Alison, please.
Okay. Right, the first one is just at the bottom of page 37, I think, is trying to understand those bottom couple of paragraphs and what it's telling us. I think what it's saying is that the caseload is lower, but there are more contacts. So is that suggesting that there's higher need for the people who are being seen? And there's also an increased length of stay. And does that mean that people with lower levels of need are not currently able to access the service?
That's a very good question about whether people with lower levels of need can access the service. That's not how the service is designed, but obviously people are being prioritised. Now, you are absolutely right that what Virgin have been reporting, and with what some of our home care providers have been reporting, is that there is an increased complexity of the level of need. So whereas you might have only needed to see somebody once a day or just have one member of staff going, certainly what we're seeing or what's being reported is that that complexity has increased and more visits are needed to be done, more support sessions are needed to be done. So that is correct, what you've observed. In terms of the number of people that we've got waiting for reablement because of a lower priority, I don't have that information to hand, but we can certainly find that for you and email you outside of this meeting. I'll do an email now to follow that up. And I presume other members on the panel would like to hear that as well, because it's quite it's quite a key piece of information, isn't it?
Yeah, okay, thank you. Because yes, I mean it's a concern in a way if people with lower levels of need can't access, because that's that's very much a preventative measure, isn't it?
Absolutely, absolutely.
Okay, and then just a couple more minor points really. Firstly, I'm just wondering what the waiting times for children's audiology and autism assessments are, and also what sort of conditions are people in the priority 2 group for OT assessments? What are their needs, and how long are they having to wait?
So I need Claire's going to come in on the audiology one, so I'd asked her to cover that off. But in terms of the priority 2, I need to get some more information on that. I don't have that to hand today. But again, we'll put a briefing together in a bit like the way that Kevin described, if you like, and just scoop up the questions. I'll do an email with all of them in. Well, Alison will do the email with all of them in. But Claire, can you come back on the audiology?
Absolutely. So I'll do both the autism assessments. I did a quick update with Virgin Care yesterday evening on this, on the basis of the question being asked. And what the service is reporting is that they are currently meeting the waiting times in Baines. However, what had happened in year is that there was 1 month post first COVID lockdown when the waiting times were not being met, and that was due to the change of the service, because of course face-to-face diagnostic assessments were not able to be being undertaken. So that's the feedback with regards to the autism assessments. And again, if you want any additional information, I can prepare that with the service leads and come back to you. With regards to paediatric audiology, currently Virgin Care services at 73% for 6-week diagnostic waiting times. And again, there was a backlog of cases from the first lockdown period because the service was not able to undertake the face-to-face assessments. Virgin Care provide assurance on this in terms of how to managing the backlog through their safe return of services, work that they've been doing. The trajectory had said to be compliant by the end of March 21. However, they are carrying 1 vacancy with an audiology, and that will have had a level of impact. So we are now expecting that trajectory to be back online where needed in the April month.
Okay. And can I just check the waiting times target for autism assessments? Is that 6 weeks or is it longer?
I don't know the answer to that. Check, unless you know, Claire.
No, we'll just go back and confirm that one, Les.
Okay. Yeah. Thank you. Thanks very much.
Okay, have you done, Alison?
Thank you.
Right, okay, thanks. So we'll go on to Jess, please.
Thank you. So my questions were about section 4 and particularly section 4.1 on community health services. And there was some detail in here about pressure arising from staff sickness, pressure on services. And I know this is something that we've looked at in previous update reports on the Virgin contract in terms of how staff are doing, staff morale and that kind of thing. And I wanted to know if you had any more information really about the kind of cause of that staff sickness and whether stress is a factor on that. And if this is something that we could look at in more detail in the next update report, which I think is September.
So we can definitely, we'll put that into the workforce report for September. Jess, that's absolutely fine. Do you want me to ask colleague Joe Scammell to come in, or would you rather we waited until the September report? I can't answer that directly, but Joe,
I think if you've got anything to comment now, that'd be really useful. And if we could have a bit more detail in the September report as well. Thanks. Okay,
thanks. So let me introduce Joe Scammell, working within Virgin Care. She'll introduce you with her title in a moment, but Joe works very closely with us and has been one of the primary leads around the Community Wellbeing Hub as well. I just wanted to say that at the beginning. But here's Joe Scammell.
Thanks, Les, and thank you for the question, Jess. I mean, I think it's something we keep a very close eye on. It'd be good to look at it in September. Obviously, we are keeping a daily tracker of COVID-related absence. And, you know, we are very concerned to keep our colleagues safe and well. I think if you speak to the RUH and other organisations in the health and care system, staff are incredibly fatigued with this way of working for a whole year. And in fact, we had a focus meeting about that this morning. So we are obviously concerned, and we don't want to combine that with the stress of actually the fatigue of having the COVID situation for longer and a year, and then COVID related absence. So in December, for example, we had a 4.7% absence factor, which was different than December, which was 2.9. So we've seen throughout the pandemic, peaks and troughs going into the second lockdown. Our colleagues have received their vaccination, but 3 weeks after the IUH. So we are still in a period whereby we have got some COVID related absences as well. But we haven't seen I'm just checking the statistics now, we haven't seen a massive increase. We had a peak for people off with kind of stress related absences in September last year, and we have had a decrease since then. So it's certainly flowing at the moment with the trajectory of the pandemic, and we'd be happy to report back on. But it is absolutely a concern. The wellbeing and welfare of our colleagues continues and always is, a significant challenge, more so in the pandemic.
Okay, thank you.
Thank you, Jo.
Right, so if we can move on to Michelle, please.
Thank you, Vic. My questions have actually been asked and answered already, so I won't press the points. Thank you.
Okay, then we'll move on to Andy.
Thank you, Chair. It won't be a great surprise to learn that my questions are about finance and the impact of the finance on the services that we offer. So I've got two questions. The first question is about the fact that Claire mentioned that we're about to enter the 5th year of this 7-year, possibly longer period of working with Virgin Care, and up to now, no single year has actually registered a balance or a surplus. And so far, in the first 4 years, the deficiency in funding is £2.4 million. Now, I appreciate that sounds like an awful lot of money, but I also appreciate that these are very big numbers, and it's not a huge figure as a percentage of the amount going forward. But my first question is quite a simple one, and that is that by the end of the 7 years, would Virgin be expected to have a balanced scenario? Because it seems to me that will suggest that there will be greater cuts in the service going forward. That's the first question. The second question is related to that, and that is that in the papers on section 3.9, there's a mention of a £1.2 million cut in the service this year, and then the details after that, I would very much appreciate more information, because it talks about cost savings and or cost avoidance for care and support packages or placements, and that's quite a general statement, and I would like to see, if it's possible, specifics into how that 1.2 million cut was made, which I accept it only represents about 2% of the budget. Thank you, Chair.
Right, so who's picking that one up?
Well, I'm going to do a broad response, if that's okay. I think in terms of the detail on the 1.2, we need to come back to you, Councillor Waite, in terms of that. In terms of the information, in terms of Virgin Care wanting to expand their supported living service. Now, what we've agreed is we've got quite a lot of adults with learning disabilities that live out of area. And ideally, we want to be supporting those adults to come back into the Baines area. And one of the ways that we can do that is to develop our supporting living service arrangements. And that's some of the things we've been talking to both housing colleagues about and Virgin Care. But obviously, we need to talk to other providers about that as well. But that's one of the things we want to be doing in terms of that, which is a benefit to the person, not about the service. This is about what's right for the person. In terms of your question about the cuts in the service going forward, Claire did set out at the beginning that it was a flat cash contract from the council perspective. That's not a flat cash contract from a CCG perspective. The CCG give inflationary uplifts. They give the uplift on the contract. in terms of the way that the service is going to see cuts going forward, then actually part of the plan has always been that through the transformation of services, we shouldn't be seeing cuts in the way that might be a traditional way to be described. What we should be seeing is that services are offered in a different, terrible with that word, it just will keep coming out now, but services will be changed in a way that should be delivered differently. So you'll see that a lot of the learning that's been done from COVID, for example, has meant that we've been able to adapt services. So they haven't necessarily been able to be delivered in the same costly way, but the outcomes for the person will be the same. So I think nobody wants to see cuts in services, but what we want to see is more efficiency and different ways to deliver that same service. It doesn't quite answer your question, but hopefully it gives you some reassurance that that's what the aim is.
Is it possible to have some examples of the way your service has changed and the quality of the service has not changed? Because the words that you say, make sense, but I don't have any perception of what this means.
Yeah, I think that's a really reasonable question, and we can get that for you. We'll get that for you, get you some examples as well. I'm obviously going at the end of the week, but I am going to be passing that on to my esteemed colleagues to be delivering it for you.
Okay, so we'll take the last speaker now, Ruth.
Yes, so mine is a request really. It kind of follows on in a way from what you were just talking about, how practice has changed and that some good things have come out of that as well. I'm just referring to page 34, 2.3, and one of the priorities for the transformation of the integrated reablement service, which the comment that to ensure a consistency of practice and processes between the locality teams of Bath, Midsummer, Norton and Keynsham. So it would just be really interesting to know when we next have an update, to have some maybe differentiated information about those three locality teams and how that priority, that aim is being achieved. So I'm genuinely interested to know what potential differences there are between those locations and how things are managed. So a bit more differentiated without causing you too much work. I hope it'd be really interesting to know, to be able to compare how the reablement service is perhaps different and similar in those places. Thank you.
So shall we add that? Ruth, can I just check, Councillor Malloy, do you want that in advance of the next, because obviously we're putting reablement now onto the next 6 monthly report as well, for the update, as agreed with Councillor Bourne. Do you want that included in that, or do you want that information before? Happy either way.
No, it can be whenever the next update report comes to the panel, but I just think it'd be interesting to to sort of break down the data a bit, just to, as I said, without creating too much work for all of you. It will be interesting to know how.
They'll have the information will be there, so it won't be difficult to get at all.
Yeah, good. No, to see, so that it's good to improve the overall service, basically. Yeah, thanks.
Thank you.
Yeah, it will endorse the parity between the towns and the city, because that's always a contentious point. So we've been asked to, I think we've given this paper quite a robust scrutiny. We've been asked to note the reports, which I think we can, and the next report in 6 months' time, it will update the workforce and service users for EPAC. It'll have an update on the performance of reablement, and also we do need to include finance. Paul, you're signalling.
Sorry, I had asked to speak. I don't think perhaps you picked it up. Sorry.
Oh, go on then.
Could I just, hopefully it'd be a fairly quick one. The contract's coming up for review in terms of extension in a period of time. Has Virgin indicated they wish to have that extension? And if not, bearing in mind that Your Care, Your Way took us the best part of 2 years to actually get sorted out, can I just check whether we are thinking about the next tender moving forward? Because I think it might be that we might get caught out if Virgin didn't want to extend.
Claire, do you want me to answer that, or do you? Yeah. So there's no indication at this stage that Virgin are not wanting to continue with the contract for 3 years, the additional 3 years. Certainly, that was the basis of the procurement exercise. It was a 7 + 3 year contract, and that's what Virgin, as part of the procurement service, bid for. No indication has been set that they are not interested and willing actually to do that. In terms of the length of the time that the procurement took, you'll remember it took years, didn't it? It was a really huge consultation and procurement exercise to run. So we have factored that in. We've factored that in, and what we're really conscious about is we're having to make the decision, as you know, by 2022. But if we can make that decision beforehand, we would want to be doing so, because we need to indicate to Virgin as well, and we don't want any of the transformation work stopping, because, you know, with the best will in the world, we need to keep things transforming as best as we can. So we are conscious of those factors, and also we're conscious of, you know, the time it does take to go through that whole process, not least for staff as well.
Chair, one last very quick point, and that is we've not actually said thank you to Virgin for what they've done during the pandemic. We've said a lot to our own staff, but I think it is important as a committee we actually reflect a lot of good work was done by Virgin, and we should say so as a committee. Thank you, Chair.
That's a very good point. And one of the encouraging things is year on year, we're constantly seeing an improvement in the position of Virgin. It's with the best of intentions, it's a major interruption when you change supplier. So if we can successfully negotiate that extra 3 years without changing supplier, it might be a better outcome all round, I think. So let's hope it works in that vein. So we're noting reports, and we've got the intentions of what the considerations will be in the next reports, which will be in 6 months' time. So if the panel are able to accept that, that's good. I'm going to call a 5-minute break now, because it was scheduled for 11:30 and now it's midday. So we're running about half an hour behind schedule. If we have 5 minutes, and if we can be back in that time, and then we'll continue. Okay, thank you.
Thank you all. Bye now.
Thank you. Okay, is that us all back?
Yeah.
Yeah, I believe it is, yes. So if we can continue with right, so we'll continue with agenda item 10, care home and home care commissioning. And who do we have to present that, please?
Vic, would you like to introduce Judith Westcott? Judith's the Senior Commissioning Manager that's leading this piece of work within her team.
Okay, right, thank you.
Let me just introduce yourself. Judith, and Judith's written this report for today's meeting. Judith?
Hi, I'm Judith Westcott. I joined Baines almost exactly a year ago, and I'm the Senior Commissioner for Health and Social Care, a joint post across the CCG and local authorities.
Okay, so it's a joint presentation again from Les, yourself, and Judith, I trust.
No, Judith will just be delivering the report, Vic.
Okay, right.
Thank you, Judith.
So can you go ahead then, please, Judith? Thank you.
Indeed, yeah. Thank you for inviting me today. I gather that it's been quite a while since you've had an update around the care homes and home care activity. And so the report that you've got is a kind of general opportunity to talk through our thinking at this point in time. However, as Les has been describing to you, you'll be aware that COVID has taken up 99% of my team's time over this last year. I've only actually met 5 of the council staff in total. All the rest has been on Zoom calls and team calls. So we've had a very unusual year. But through that, what we have been trying to do is to start thinking about the next 3 years and how we want to develop our thinking around care homes and home care and some of the ways in which we want to work. So what we've set out for you here in this paper is an opportunity to start thinking through some of the strategies that we'll be using, of which we're talking about 3 main sorts of strategies. So myself and Debbie Forward, who you've probably met before, we both work to Les. We'll be looking at an overarching strategy to talk about how we think commissioning should progress. And we'll be doing that with our CCG colleagues and indeed with Virgin Care, thinking about how we want to develop that. And that will very much be picking up on the conversations we had earlier on about the integrated care systems and how we develop commissioning within that framework. But in the meantime, what you've got here is what we're describing as engagement strategies, which essentially are the kind of the busyness of everyday life that we need to get on with, whatever the bigger picture might be, talking through some of those actions. You'll also see that we refer to the market engagement strategy and then the market position statement. And the market position statement is something that we will continue to update annually, which lets providers know the kind of things that we are needing to talk to them about, the kind of services and provision that we need going forward. But the main part from this report you'll see is I've just given you, if you like, I suppose, a taster of the actions that are being put into those 2 strategies at this point in time. So these actions, in some places, we've managed to start getting off the ground in this last 12 months, but largely they're actions that will really come into effect as we hopefully move further away from COVID and are able to start thinking about the business as usual again. So you've got the I think it's 12 for one strategy and 10 for the other, and then a way in which we'll be starting to build on how we monitor that. We create key performance indicators so that we can then monitor ourselves, as well as the work that we do with our providers and broader engagement with the CCG and of course the third sector as well. So I probably don't need to go into much detail. It's probably best that I almost hand over straight away to you for questions, for things that you'd particularly like to ask us about any of the actions. As I say, these strategies are still in draft formats, which is why we're bringing it to you here at this point in time, so you can start thinking about it too. And we'll be hopefully, before we start too much into the new year, COVID being kind to us, be able to start putting these down as formal strategies as well as we go forward.
Okay, Thank you, Judith. Now, I've no questions at the moment, so I'll ask you to start it off. And it says 436, cleansing of data heads by Baines, and it says liquid logic is not consistently recorded. Why is that?
Okay, so that's one of the things that we're aware of, is that one of the difficulties we have is, not surprisingly, the more people, partners you get involved in, the different systems that you have working together. And so we have systems that are run by Virgin Care, systems that are run by the CCG, and then systems, and sometimes data can morph or change as it goes through that. And certainly one of the things that I certainly will want to prioritize this year is ensuring that we have a consistent data set. And that fits in work that's already begun by Les and the team, which is looking at how we align that with the national data requests as well. So we're looking to try and use more of Power BI and the such like to ensure we can keep on top of that data, and also ensure that the work we do with Liquid Logic actually supports that, so that it's one point of data entry whenever possible. And at the moment, there are a number of places where there are multiple points of data entry, which just can cause difficulties. So we need to look at that and see how we can develop that in these coming year to 3 years.
Okay, thank you. Alison.
Thank you. Yes, just a couple of questions in relation to the home care engagement strategy. Looking at that, the focus is generally on costs, the different, so that the providers are segmented by cost. And I assume that you will also be taking quality into account. And I just wanted you to say a little bit more about how you will be assessing the quality of the care provided by home care as well as the cost. So that's one question. And then the other one was just if you could say a little bit more about the types of assistive technology that you would expect to be used.
Okay.
Thank you.
Thank you. So with the quality and cost, each of these 3 strategies has 3 overarching aims. So one is around quality, one is around process, if you like, and the third is around the cost. And we acknowledge that any action we take has to deliver on all 3 of those fronts. So we know that there have been some difficulties here in Baines with the costs escalating, and therefore there is a specific aim to ensure that we manage and wherever possible bring down costs. But you're dead right in saying with the red, green and amber, although we've highlighted this under cost, in fact that's also relating to quality. So one of the things we need to do is to better articulate our contract management, which ensures that as we look at that red, green and amber, we're actually talking about quality, process and cost within that rating. And that's all work that needs to be developed over these next 3 years. And then you were also asking about assistive technology. I think at this stage, it's quite an open agenda. So what we want to do is a piece of work which covers our CCG, Virgin Care and ourselves in the third sector to really set out the ambition we might have. As you're probably aware, during this COVID period, there's been some amazing statistics which show the increase in access and use of IT during this period, particularly amongst older people. I think there's a quoted 24% increase in access and use by people over 55. So really our starting place is wanting to capitalize on that and actually see how we can move that forward. But the assistive technology could be anything. It could be as simple as the kind of things we're using today, the tablets, the phones, etc. But we're also aware that there's a huge range of devices which support people in terms of their mobility, in terms of their security, their safety, their communication. And what we want to do really is to set out a process for Baines at this time to really say, where do we want to put that priority and focus? And as again, you say, we know that there are things that people can talk about in terms of cost, but actually I think it's much more about understanding how, as people get older and as generation changes in terms of their knowledge and understanding of IT, how we can change and adapt around that to ensure that actually we're making the most of the IT that's available at the same time as giving people the maximum independence that they have. So it's quite an open agenda at this point in time. We just know that now is a great time to strike and be able to start doing that work with a partnership approach.
Okay, Paul, please.
Chair, thank you. Judith, I'm just a little bit confused at the moment, and I wonder if you can help me. We've got care homes mentioned in the report. We've got 3 care homes which we actually run ourselves, not with Virgin. And how many private care homes are there, and how many are we contracting with of those private ones? And the follow-up question is that I've read the report and I can't see any reference to CQC in the report. And obviously that's the judge, if you like, of the quality of the provision that's being made. And I don't understand how we can apply CQC standards to effective home care. So I'm sorry, it's just that I just feel I need some facts.
Okay, so if you like, this report is telling you about how we're going to go and do about the business. So at some point you might want to come back to us asking for a next report telling us about some of those things, about the facts and figures for where our care homes are at the moment, and we would really welcome that engagement, because certainly when Les and I were talking about this, developing this report for you, we're aware that you probably haven't had some of those facts and figures in the recent times either. So that's part of our strategy, is to ensure that actually we get that data together in a way that actually works for you, but also broader as well. In terms of our care homes, you're dead right. We have 3 of our care homes at the moment that have come back to us from Sirona. They are one of 35 homes that we work with in terms of ongoing older people's care. In terms of the contracting relationship, we have most of those on a framework, which is basically a shape by which we work with them in terms of our expectations, which of course includes their engagement with CQC. Each of those homes will have their own CQC rating, and part of our work, which is identified as one of the action plans, is to develop our contracting engagement. I have to say though that I've come to a very good team. The work here is already very good in terms of their engagement, in terms of contract monitoring, and they will be continuing that and developing that as part of this strategy. And of course, as you say, any review of our homes continues to always work very closely with CQC. Particularly during this pandemic, we've been involved in weekly meetings with them where we've been talking with them about the quality of all of our care homes in Baines. As far as home care is concerned, they also have to register with CQC, so they also have a rating. And indeed, as the other councillor Alison was asking earlier about how we involve that, they also will come in terms of how we engage with them and how we work with them. And clearly what we want to be doing is to be working with those providers who have the best CQC ratings, who have the best prices for us, and also want to enjoy working in Baines and work in that partnership approach. So that's what we will be looking to. But indeed, I'd be more than happy to come back to you to give you some of more that kind of nitty-gritty data as we go forward into this coming year.
Thank you. Liz.
Hi, I just want you to clarify something for me because I'm not sure exactly what it is. It's on page 54, paragraph 4.7.3. And could you explain how Baines is in the bottom quartile of the continuing healthcare league table for the way we undertake assessments, and in the top quartile of the funding nursing care table? And could you explain further what you mean when you say this demonstrates a significant potential in looking at the way we carry out CHC assessment to ensure our services are funded from the right budget sources? So I'm not really clear about that one.
Yeah, indeed. I mean, certainly when I arrived, these figures aren't new to Baines, so we've known for quite a while that we're an outlier in terms of the number of people who are benefiting from CHC funding, and indeed in terms of an outlier again, but in the opposite direction, in terms of the number who are receiving funded nursing care. So we will need to do work as part of this strategy to try and understand a little bit more about why that is. So we'll be need to be doing some reviewing work. And to understand.
Me, so now I'm getting feedback. I'm Sheena.
I'll keep going, shall I?
Yes, please.
So the review work will just really need to understand that, and certainly as somebody who's coming in new, those figures, as I say, are unusual. So we'll need to have a look and just check how that's impacting on people, and how we work with our colleagues across health and Virgin Care to ensure that we are getting the right provisions for the right people costed in the right way as we review those packages. So Les was talking about that earlier, about investing in time to do the review work, particularly as we go post-COVID, and that will certainly be part of it.
Could I just ask to clarify something else? So what do you mean by ensuring our services are funded from the right budget sources? Are there different budget sources here that?
Oh, there are indeed, yes. So CHC is a health funded source, and people can be funded from a number of sources. So they can be funded by themselves, so they can be self-funders. They can be funded through health, through CHC and other mechanisms as well. Or they can be funded by the council, depending on their assessment. So it's often the case that where people's funding changes, we have to reassess them. So it's quite a changing picture for many people. And equally so in terms of the application of the criteria around those funding, where is it health, where is it social care? That's something that we always need to stay on top of and ensure that we're getting that just right.
Oh, thank you. And Vic, could I just ask one last question? Because I'd really like to know the answer to this. And I wonder, are you a miracle worker? But it says, page 49, paragraph 4.2, in respect to the two market engagement strategies, how are we going to achieve much improved outcomes with reduced costs, bearing in mind that costs, wherever your best efforts, costs are going to escalate when it comes to healthcare?
Oh, I think you did right. It is a challenge, and it's one of those challenges that I think is set before every commissioner, to find ways of improving quality while also bringing down cost. I think some of that here in Baines is particularly about building on our partnership working, and I think we've got a lot of opportunities here to work well, not just with Virgin Care, but each of those care home providers and home care providers to develop those services. So I do think there are opportunities in terms of how that goes forward, but equally so, I don't come with any magic wand. So I'm not expecting suddenly to overturn the budget. We will need to take steady steps in order to be able to take that forward.
Okay, thank you.
Okay, so Kevin, please.
Thank you, Vic. Judith, yes, just one question has already been answered. So two questions and a bit of clarification, please, if I may. The first question is, you mentioned in 4.5.4 about monitoring home care contracts and developing new and innovative ways of monitoring through technology and online tools. Did you have anything in mind at the moment about how that monitoring and who does it?
Well, at the moment, before COVID, what would have happened was, as myself and my team would have gone out to visit care homes and spent time walking around with them, sometimes with CQC, sometimes on our own, and taking that forward. COVID has really sort of challenged us as to how we stay on top of that. And certainly we've very quickly had to start using things like the technology that we're using here and engaging with virtual visits, etc. So some of that needs to be taken on board. I think also one of the things that I'm very keen to do is to develop the voice of our service users. And I think that's been really helpful during this time, where we've been able to do the odd virtual call with a resident or with a member of staff and get them to talk about their direct experience. And I think that's a real positive in terms of understanding a little bit more about what's happening in our homes. So I think it's partly, as I say, using that virtual technology that way, but also about, for example, the capacity tracker has been fascinating. The capacity tracker used to be just as a one-off tool used by the odd local authority. During the pandemic, it's become a national provision, and it's been amazing how we've been able to start comparing and contrasting the value of care here compared to the value of care in other local authorities. So I think using that national data capacity as well will be really helpful.
Right, because obviously there's always a danger with virtual visits as opposed to an actual visit, isn't there? Because you don't know what the circumstances going on when you can only see a bit of a screen.
Yes, indeed.
The other question, very quick, really, under 4.6.3, the voices of service users. Does that also include the families of service users?
Oh, absolutely. I mean, if you think what we've been going through with the pandemic and how very difficult it has been for family and friends to stay connected, and I think that will be a really important part of this strategy going forward. So we're very much hoping to work with the third sector, and you heard earlier as Claire was talking about the work of the volunteers and how they're taking forward. We're already starting to explore with them how we can do new work with family and friends to find ways of staying connected and then engaging them in how we develop the quality across our homes and home care services. So yes, I think that's really important.
Great. And my last bit of round clarification bit, and just to check my understanding really, was you mentioned, and sorry, I didn't write down the paragraph, but towards the beginning about the savings around discharge to assess. And it's my understanding that it was being funded nationally, this discharge to assess, and now from 1st of April it's going to be CCG, and will that still create cost savings and things?
Well, we still don't know the full answers to that, so we're still waiting for the full information. But indeed, through the pandemic, national provision has supported our local CCG to bring money across for the discharge to assess, the 6-week process. And indeed, that has affected our budget here in Baines in terms of that funding has facilitated us to keep moving forward during this time. What we don't know is exactly where that funding will come from going forward and how much we will continue to need it, on the basis that the discharge to assess processes have been extremely rapid over the COVID period, particularly with the 2 peaks that we had during that time. So my team have spent an awful lot of time supporting that process, finding provision to go forward. So we're still waiting to hear the full answer, but in many ways it would revert back to the council potentially, but there's also been conversations about how that might relate to the Better Care Fund, and indeed how it might work with the new integrated care system. So we're waiting to see. We know at the moment we've got funding definitely up until the 12th of May, so that's 6 weeks from the 31st of March, but we're still waiting to hear what will happen, and there are conversations about potentially supporting the first quarter so that we know a little bit more, because obviously we don't know for definite exactly how the curve of the pandemic is going to go. We're hoping obviously that the vaccines will make a significant difference, but we just need to plot that carefully over the next few weeks and months.
Thank you very much.
Okay, Andy.
Yeah, just a quick question, Judith. Thank you for your candid answers so far. It's about you're looking for increasing the number of providers of care homes. I was just intrigued to know how far away from Baines you are going, if indeed you're leaving Baines at all, looking for these care homes, because we have known in our children's and young people's service that they've been many hundreds of miles away. Now, I don't think that happens in your service, but I just wondered how far you would be prepared to go to get to a good facilitator.
Well, I think it's quite interesting. It's a good question you asked there, Councillor Waite. In terms of our home care, at least a third of our home care providers are registered outside of Baines, but we make the benefit of their support, and that's worked perfectly well. We've not had a difficulty with that, as you can imagine, going out and about. As far as our care homes are concerned, we know that the boundaries that we work with as a CCG and local authority are not necessarily those that people work with in terms of the communities that they exist in. So, for example, Frome, the edges of Trowbridge, Bradford-on-Avon, etc., are considered to be home to many people, even though they are technically Baines residents, as it were. So we would want to really follow our service users in terms of the stretch that they would want to consider. But you are right in saying that on the whole, in older people's, we don't go that far. So it's not as in learning disability and mental health, and often to get a specialist service, we have to go further afield. But with older people, on the whole, we try and, wherever possible, keep people in the community that they've already identified with and can consider home.
Okay, Judith, and I'll take a final question from myself to you. And it's on page 52, where the comments made, similar projects, for example, in Worcestershire, have resulted in savings of around 100% of the initial investment and cost avoidance of around 750% of the initial investment. The Baines model would be based on the work that the Worcestershire has undertaken. Now, these are huge statistics, can you give how they interpret themselves? What does it mean for the individual?
I think at this stage, we don't know the full answers to that. So we know that we want to do this project work. I have colleagues who worked with me who used to work in Worcester and so have seen this in action. So we're very excited by this and we think it really might be able to offer us something. But at this stage, it's just a marker we're putting down in terms of how we would like to progress this work and what we would like to see developed. In terms of any individual, I think the main impact has got to be on their independence rather than the financial position. At the moment, I've sort of put it in there as a marker in terms of what we might achieve. But as I was mentioning earlier to Councillor Allison, I think this is about ensuring that any piece of work we do looks at process and partnership, looks at quality and looks at finance. And so I'd be wanting to ensure that any work we took forward on IT was covering all three of those points.
Okay, fine, thank you. No further questions. So at the moment, we can only, this is just a report for us to note, but certainly the ambitions are very encouraging. So let's hope it all goes as intended. Thank you very much, Judith. Thank you.
That's fine. Thank you.
So if we can move on to item 11, and that's suicide prevention work. And if I can invite Paul Scott to present the report to the panel, please. Thank you. Thank you, Paul.
Thank you, Chair. Hi everyone, I'm Paul Scott. I'm Associate Director of Public Health here at Bath North East Somerset Council. I've met some people before, but not everyone, so it's nice to see people on the panel today. This is an update on our suicide prevention work. I can just give you a very brief background about it, but hopefully most of it was in the kind of cover paper and in the action plan. The local authority has a responsibility to lead suicide prevention work for our population. We developed our strategy about a little more than a year ago now, and then held a stakeholder day with a sort of wide group of people, trying to get as many people with lived experience or organisations working with people who've been affected by suicide as part of that stakeholder day. And that was last February. And it felt like a really helpful day. It was really informative and it gave rise to lots of actions people wanted to take forward. And then unfortunately, COVID-19 pandemic really took off and obviously overwhelmed or rather took over everyone's work plans then for the remainder of certainly the summer. So we picked up again in the autumn and reformed an action plan. And it's the action plan we're really bringing today. And I can summarize a little bit about the action plan, but I won't go into too much detail because obviously it's too big to talk through. I mean, just as a background, Baines has a suicide rate that's similar to the England average. The Southwest has been higher than the England average for years, and our rates of self-harm admissions to hospital have also been higher than national. I think we're about the second highest region in the country, and our self-harm admissions in Baines are higher than the England average for reasons that we can go into. So having a suicide prevention plan is really important, and we've done a fair bit on it within the resources we've had over the last few years. And this is an attempt to widen the work we're doing and really bring in our colleagues in the third sector, recognise and work with our colleagues in the NHS and with Virgin Care and so on. So it hopefully is a really broad plan that covers all sorts of things from supporting people when they're perhaps in debt or have job issues or housing issues, to supporting traumatized NHS staff who've been through really difficult circumstances. So it's a really broad plan. I'll open it up to questions, I think, quite quickly, because hopefully you've had a chance to see the plan. It covers quite preventative things from kind of improving mental health and well-being across a range of groups who might be at slightly higher risk of poor mental health. It's got quite focused things, for example, working with British Transport Police or Parks and others on higher risk locations. It's got plans around supporting people who've been bereaved by suicide, which had been a gap. It's something we've addressed over the last couple of years, developing bereavement support work, but we're actually trying to build on that further. We're really trying to improve how we're notified and learn about suicides really quickly, as in within days, so that we can offer bereavement support to people affected, and we can have better surveillance, so that if one of yourselves was to ask us, have we been affected any worse or any more than we would have expected by COVID, we'd be able to tell you a really good answer, rather than saying, I'm sorry, you'll have to wait a while until we get our statistics and things through from Office for National Statistics. So those are the kind of key types of things we're doing. But I'll open it up and hand over to you, because you might have questions or you might direct me to tell you things that would be most helpful for you.
Thank you, Paul. Michelle.
Thank you, Paul, for your report, and the action plan's really comprehensive and obviously covers a lot of ground with a lot of agencies. So thank you for sending that to us. I've got one question and one request. So my question is, in your opening comments, you mentioned that Baines has a higher than average self-harm rate, and I just wondered if you could tell us why that is. And then my second thing is obviously we've talked about the impact of COVID on mental health. It'd be interesting to know, probably in a few months' time from you to this panel, if we could have an update, on the impact of that, because I don't think that impact is probably hasn't manifested itself yet. So I'd be quite interested to hear how the action plan has, if it's been successful in terms of the fallout of COVID.
Yeah, thank you. And actually, I should have said, and you kind of prompted me actually to think that two colleagues from the public health team, Thelia Lacheras and Hannah Elliott, played a huge role, more than me, in actually putting the action plan together and helping get all our work ready and following up with stakeholders and so on. So I just want to recognise their work as well, because they've done all the hard work in actually getting it ready. It's self-harm. So there were two questions there. The first one's about self-harm, and it's a really good question, and I don't think we fully understand it, and it probably needs more regional and even national work, ranging from, some people think, and it's positive in a way, that our self-harm admission rates are higher, because it means when people turn up at the emergency department, they're recognised compassionately, they might be admitted to hospital for observation, they get support from CAMS or adult mental health services like AWP, and so we appear to have higher rates, but in fact it's because we follow nice guidelines, we're very compassionate. And other regions perhaps have, you might turn up, but you're discharged quite quickly. On the other hand, maybe we have more need in our population, and we do have higher rates of self-harm. And it's not clear, to be honest, and it's slightly beyond, if that doesn't sound silly, it's slightly beyond one local authority to fully understand that, because it is across the southwest. And it might be a bit of both, unfortunately. But yeah, so we're not really fully sure about that. But we do have slightly higher suicide rates as well. So in the southwest region, not in Baines, but in southwest region. So, they probably are related, and they probably reflect real need. The second question was about mental health and the impact of COVID. And I guess there's probably a very direct impact, and then a longer term and wider impact. Direct impact, of course, being it's stressful being isolated, it's stressful worrying about a pandemic and an uncertain future, it's stressful not being able to see people or go out. And if you already have anxiety, depression, some kind of other severe or serious mental illness, you perhaps can't see the people you might in normal groups that would help. You can't necessarily easily face-to-face see people. So there's direct impacts that can increase or exacerbate kind of mental health and distress are real, and that's being responded to as part of the mental health system, local authority, NHS, Virgin. We've got a partnership that constantly tries to respond to that. The longer term impact, which you're kind of hinting at as well strongly, through job loss, through relationship breakups, through bereavement, through all sorts of things are the subject of our thinking and planning. And we are in the early processes of, bringing a kind of roadmap for recovery, in a sense, and what that looks like, because it's such a huge thing, isn't it? What that looks like as we come out of the most acute phase of the COVID pandemic into how do we help people who perhaps have been furloughed but now have lost their jobs, or the impacts of bereavement when everything's calmed down. How do we support people? All those things. So it's in our planning, and the most acute bits we've been working on anyway, but that's definitely there. And I think that would be good. I'm sure the panel will be really interested to see some of that roadmap work when it comes out.
Thank you. Jess.
Thank you. Thank you for the report. And just a comment to say that it was really good to see the focus on NHS workers and frontline social care workers. I had a couple of questions. Firstly, just to ask whether there is any evidence that in this last year there's been an increase in suicide rates in BAMES. And then secondly, to ask how the universities are involved as a kind of partner organisation in the prevention work.
Thank you. So the first question, we're not aware of any increase in suicide in BAMES so far. The figures I just got sent through this week are our latest figures, which have all the deaths registered in 2020, showed an almost identical rate to the year before and the year before that. So to date, we're not aware of any increase. And that's largely the same actually as the national data. So we'll see, because there might still be more registered, but so far it doesn't look like there's been any significant increase in suicide, which is a reassuring thing. The second one, in terms of universities, so both Bath Spa University and University of Bath are part of our governance group. We're meeting tomorrow, I think, our quarterly governance group. So they're both part of that group and have been in the past. And I'm also part of a working group at Bath University looking at suicide prevention for their own students and staff.
Great, thanks.
Kevin, please.
Sorry, Vic. Moving the wrong thing in the wrong place.
We all do it from time to time.
Yes. Paul, yes, just a quickie. On your Appendix 1 on page 75, you mention in one of the last bullet points at the top about the fact that 3/4 of people who died, many had been in touch with their GP or another kind of health and care service. And I just wondered how this information is gathered in your action plan to sort of prevent suicides and signpost effectively.
Sorry, can I just clarify? Do you mean how we know that, or how we use that to do something?
Well, presumably you must know it because you put 3/4.
That's right. Yeah.
But what you do with that information, how you sort of use that effectively in your plan?
That is a good question, and the reason we know it is from the work we do with the coroner, where we find out. We ask a range of information for everyone who's died to find out that information. You know, were they seen by the GP? Are they in contact with drug treatment services, and so on? So we use that separately to knowing whether they were in touch with mental health services like AWP, and we use that with the idea that not necessarily. The idea that something specific could have been done or seeing it in that way, but more of there probably are opportunities to be thinking more broadly or engaging in conversations or assessing risk and so on. And so for our work, for example, that we intend to do around training across the wide workforce and across third sector colleagues and so on, but also with GPs. So that kind of range of different people who people may have been in touch with, because it includes everyone from GP to sort of third sector counsellors to so on. So that it's a kind of universal type thing of building, or rather reducing stigma. It's okay to talk about suicide. It's okay to engage in a conversation with someone who's distressed. You're not necessarily opening a can of worms. It's okay to talk about it. And also feeling more aware and more confident of what's out there, so that people can have just an initial conversation and be able to know how to support people, either to help themselves or to where they can get further help. So it's quite a universal approach to destigmatizing and building kind of capacity probably through training, virtual training this year across those organisations.
Thank you.
Alison.
Thank you. Yeah. Yes, thank you. A really, really good comprehensive plan. So excellent to see that, and good to see how the broad range of partners that are involved in it. But just an observation, really, that I think one of the keys to preventing suicide is enabling people to access support at the time that they need it. And I seem to remember from the last mental health support report that we had that there was reference to the fact that some new helplines have been established during the time of the pandemic, which I'm sure will be really useful in delivering that. And I'm just wanting to check that they're going to continue and that they're not just a COVID thing. And as we start to come out of lockdown and things start to get a little bit easier, they're not going to stop, because I think those sort of mental health helplines are very important. And the other thing, though, that's sort of more of a concern really is that also from the last report, it was clear that waiting times to access mental health services, both for young people and for adults, had gone up quite significantly. And I'm wondering what's happening about bringing that down, because obviously that will be a barrier to people getting support. And that could feed through to more people actually enacting suicidal feelings rather than just feeling them. Thanks.
Thank you. On the second one, I might just check whether Les or anyone else wants to just pick up on those when we come to that around mental health, waiting times and so on, because it probably takes us more into mental health commissioning and so on, which is probably more under Les's brief. But the first one, the helpline, the main one I imagine you might be referring to is breathing space, and a mix of the daytime work that under our community wellbeing hub, there's been a mental health pod, and that's taken that, probably almost 2,000 phone calls across the last year from people who've contacted the community wellbeing hub and sort of been triaged into the mental health pod. And I agree, it's worked brilliantly. And then in the evening, there's breathing space run by Bathmind, which likewise has been a phone line this year and had a similar amount of activity. And my understanding is that going forward into the new financial year, the intention is to, when possible, start to run face-to-face opportunities for breathing space in particular, which is the evening one, but also continue phone line. And I think in the day with the community wellbeing pod, so try a kind of mix of phone and face-to-face, because some people really value or need that face-to-face, but the phone line is probably actually more accessible for some people who either perhaps live further away, have less mobility, or perhaps face-to-face is too much. So I think it's really interesting just seeing how helpful it's been this year, hasn't it? So I think a blended approach will probably go forward. Les, I don't mean to pull you in, but I don't know whether you've got any thoughts about, if you just want to add anything about the kind of weights in mental health services and things.
We did. Thank you, Paul. We did discuss this a little bit earlier on in the meeting, and I've said I've done an email already out to colleagues to just do some further investigation for Councillor Bourne in terms of that, actually. So okay. I hope I've copied you in, Councillor Bourne, so you can see the email.
That's great. Thank you very much.
Okay, Liz, please.
Paul, I think this roadmap that you're going to produce is going to be very useful. So we look forward to seeing that perhaps at a later date. And I think you must be feeling every time there is a suicide, you feel what could be done to prevent it. And we've talked a lot about mental health issues. And like Alison, I am concerned about waiting times. And I think I did ask a question about that in our meeting in January about waiting health times. So Les, I would be interested to be copied in on that as well, because anecdotally I've heard there is a problem there. But Paul, you've mentioned, as well as mental health issues, you've mentioned really poverty and about financial well-being being a risk factor for suicide, which I think is very good to flag up. In paragraph 2.8, I think it's page 69, you said that we should be raising awareness of the advice available on issues including debt and benefits and employment, housing, etc. But it's only offered by the Citizens Advice Bureau. And although they do a fantastic job, are there any plans to expand on this? Because obviously this is as COVID goes on and more people are in furlough, have lost their jobs and are in financial hardship. Is there anything that you're doing to expand provision for help for people?
No, you're absolutely right. And I think when it says Citizens Advice, we sort of mean as a lead agency rather than as the sole agency. But I think that is part of that bigger roadmap type thinking, I think, isn't it? It's partnership across our sort of employment and skills teams, across Department of Work and Pensions, Local Job Centre Plus partners. It's so broad, isn't it? that it's well beyond one agency like Citizens Advice, but they obviously have a big role, and they have sort of potentially a sort of coordinating role alongside us. So I think you're right, and I think that will be, as you proceed with talking about the roadmap, I think it's part of that, isn't it? It's the longer term recovery, and not just kind of broader economic recovery, but recovery for people really who are facing these huge impacts on their determinants of health. We talked about these at our stakeholder event in terms of contributory factors, and that many of us might experience one or two of these things over a period of time, but for people who start to have 2 or 3 of these things, perhaps lose a job, lose a house, lose a relationship, we know that those are really risky times. So yeah, I'm not sure I can say much more at the moment, but I completely take your point. Would recognise that is part of that bigger roadmap thinking. It's a much bigger piece.
Okay then, Paul.
Paul, hello. I just want to start off by making the comment about public health coming to local authorities in the last reorganisation. And I'm just thinking about a few years back, would we have had this discussion as councillors who care about the community? We probably wouldn't. So great credit to you for the report. I think it's a really effective report. You won't be surprised that I'm coming at it a little bit from the children and young people dimension. And I suppose you made reference to 3SG, but 3SG tends to focus more on the adult marketplace. There's bodies like DHI, Off the Record, Mentoring Plus, Bath Play Area, Youth Connect, all of which are actually focused around young people. And it just strikes me a little bit about the report appears to be very much around the bureaucracy rather than working with the third sector around young people. So it's just a thought, if you perhaps could think a little bit about developing up the role in the future. If I'm right, if I'm not right, I'll apologise.
I think that's potentially a fair point, and I might just say I'll take that away, if that's okay, as a helpful point to look at how we can make sure we're doing that. We do have representatives from young people's either groups or teams within our governance group, but I think it's a fair point. So we'll take that away, Councillor May. Thank you very much.
Thank you, Paul.
Mark.
Thank you. It's a really good plan, Paul. Very impressed to read it. I'm just questioning about resources. You're making some strong statements on the objectives section. You feel you have the resources in place, and mental health is notoriously underfunded, sadly. Are you confident you've got the money in place to deliver what the plan says, or are you going to run into the buffers at some point?
No, we don't intend that, and it's this work is really delivered as part of our business as usual work in terms of the resource of myself and those 2 colleagues, Thalia and Hannah, who I mentioned, are part of our team and public health budget. So for us, to a large extent, it's a strategic piece of work. It's about trying to engage, gaining commitment from all these partners and organisations. So we commission very little, and we can have a separate discussion about whether that's sufficient in terms of whether we would like to do more if we could. It's worth saying that we do get additional resource through NHS England, which is all in partnership with the CCG. So, for example, we're about to do some work with the coroner, with the police, and set up some really rapid bereavement support work. And that all comes through NHS England money. And what tends to happen is NHS England, off the back of a national objective around suicide prevention, pass out some funding to deliver very specific things. So it's kind of, we can do specific things and we get funding for them, but that's where it kind of stops. So everything mentioned in here is all through just normal business as usual work, where it mentions, for example, things like breathing space that we mentioned earlier, the phone line, that's through the existing breathing space commission. Or if we're talking about work with children, young people, or Citizens Advice, it's what they've committed to doing. Or if there's some training, virtual training, again, it's what perhaps 3SG or others have been commissioned to do as part of virtual training. So we've kind of scooped it all together and gained commitment from everyone to what we want to do is have this momentum and commitment towards a kind of community-wide suicide prevention. But in a sense, there's no commissioning here. There's almost no contract. So yeah, it's a kind of an influencing and coordination piece, as it were.
Okay, final speaker, Ruth. Ruth, you're on mute.
Sorry, didn't check that. Just following on about really the comment made how important it is to work with younger people. In the appendix, I think it was, you have, it's not terribly clear, but I think it refers to self-harm by 10 to 12, 24-year-olds have more than double the rates compared to older adults. So that, just wanted to emphasize, the work you're doing with the schools and nurses in schools is really important. Because preventative work, obviously that's what you're aiming at, isn't it? So, and it's quite shocking, I think, really, that is probably going to increase because of COVID, sadly. Let's hope the schools reopening will be, that's a step in the right direction, but there's so many, I think there'll be a lot of consequences in the future. So thank you.
Okay, Rob, you want to come in?
Yeah, I just really want to pick up on a point that I think Mark picked up, and I think it's been alluded to on 2 points. One is obviously the mental health, and just really throw out some awareness that there is quite a comprehensive paper going through the process regarding commissioning of mental health services, where we're looking to consolidate some of the commissioning that's going on and also develop a much wider partnership and support in there. And what I'll take away from this is I'll go back and see how far it goes down into the younger elements of support. I think it does, it should do. And the whole commissioning piece is it will show us some savings because of the way that the model is actually being promoted. But to be honest, I don't intend to readily offer these savings up to the council for part of their budgetary challenges. I actually want to sort of see if we can actually utilise and reinvest that into areas of support wherever we can. So I thought I'd just let you know that. And when it's appropriate or when it's ready for, I'll ensure that members get to see the paper on the commissioning of those mental health services.
That's the spirit, Rob. Keep it where it's most needed. Right, so just a closing comment from me, Paul, is that the report identifies that men are 4 times likely to be subject to suicide. Can I take that it's probably most likely to be street homeless or ex-military?
I wouldn't say that's the case, but I would acknowledge what you're saying in terms of both those groups, street homeless, and people with a mix of substance misuse and mental health issues are at high risk, as are veterans. You're right, I agree, both are at high risk of suicide. In our figures and universally across the country, we see that ratio of about either 3 to 1 or 4 to 1. That's what we see in Baines, 4 to 1. For every death of a female, we see 4 male deaths. It's probably a variety of reasons, because, for example, if you look at the self-harm figures, admissions self-harm to hospital, female self-harm admissions very much outweigh male admissions. It's partly about, it's probably a variety of things. It's quite complex to go into, but it might be about male health-seeking behaviour. Males aren't always so good at coming forward. They don't like to admit there's a problem. They don't like to talk about things as a cliche, but there's some truth in it. There's something about the methods people choose, and males tend to choose more violent or effective methods, let's put it that way. So there's something about the two that go together. it's probably subject for a slightly longer discussion, but yeah, I think it's, I recognise completely what you said, and I think there's a broader range of reasons why males are kind of more susceptible to suicide.
Okay, thank you, Paul. It's appreciated the amount of work you're putting into this, and it's no mean challenge in itself. We're asked to note the refreshed strategy that you have and amend the action plan. Seemingly, we don't have any amendments to make, so obviously your plan's quite robust. We look forward to the effect of it, certainly.
We'll take on board the comments that people have made about particular age groups or particular themes as well. So we will take those away and see whether we need to just adjust some of the plan.
Smashing. Thank you very much, Paul. Thank you. So we move on now to the Health Infrastructure Program to HIP2 updates. So if I can invite Simon Cook together with David Rose to present the report, please.
Thank
you. Just before they start, say that Michelle and myself have had the privilege of meeting with Simon and David to get an introductory perspective of this report. So, and it was very enlightening. So if I can ask Simon and David, if you can give something similar to the panels that you gave to Michelle and myself, that would be very much appreciated.
Thank you, Chair. Yes, it's very good to meet with yourself and the Vice Chair last week. I won't do it exactly like I gave you last week because you asked me to keep it down to 5 minutes in terms of an introduction, and I want to make sure that there's sufficient time for questions within that. But you'll recall that when you kindly received me in January, I gave an update, and we talked about the need for us to press on quickly with the scheme here, the new hospital scheme at the Royal United States Hospitals, Bath. I should just say actually initially that the one change has happened is that the national programme has changed its name. So it was HIP2, you'll recall, Health Infrastructure Programme 2, and that's now been changed to New Hospital Programme, so NHP. So that's a national level that's been set. It's a slight misnomer in a sense because actually a lot of the investment is not just about hospitals but is required in the community as well. So this is not just about hospitals here at Bath. I recognise investments required, so beyond that. One of the messages that I gave in when we met in January was that the need for us to move quickly because we want to take advantage of funding that is available, and that position hasn't changed. The numbers are scary in terms of obviously the deficit for the country at the moment. There's £3.7 billion available over the next 4 years for hospitals, and we've just spent over 100 times that as a country during COVID. So we're very conscious of the need for us to move quickly and take advantage of funding that's available. So our priority is to put in that bid, and we do see it as a competition later this year to put in that bid. And the key thing for us we're doing now is we want to work with the community, work with the local population in us shaping that bid. And crucially, that's about us developing a model of care. So, how we want healthcare to work going forward to underpin that business case that we will need to put in. If we do that well, that's actually something that will give us the edge, frankly, on other parts of the country where they haven't necessarily got a well developed or thought through approach of how we will deliver care. But we're really keen to make sure the model of care that we develop over the coming months is one that is nationally leading, that's building on the good aspects of the pandemic. The pandemic's been horrendous, but there has been a lot of good learning out of it. that's pointing to how we might want to do things in the future. So we want to build on that and develop something which is fantastic for the people of Baines and the surrounding area. So it's really important that the bid we put forward in the autumn is something which is very, very modern, describes a very modern way of doing healthcare, makes full use of technology, and it is shifting care into the community. And I and I'm sure many others have seen benefits actually of that over this last year, where I've attended outpatients appointments in this very room, in my study here at home, rather than having to do a 3-hour round trip, which is what it takes with the car parking and all of that. So we want to really shift the way we do care, so we're not unnecessarily dragging people into the hospital for something which could be done equally well, if not better, sort of at home, for instance. So really crucially for us is this engagement plan, which we've set out before you here in the paper there, and for us, engagement is something that is absolutely crucial for us. We want to do very significant engagement and involvement here to frankly co-create what this needs to look like. We've got a lot of very clever clinicians, of course, at the trust, but they haven't got all the answers. The answers need to be together with the local population. These are shared challenges and shared opportunities that we want to come together to. So we're defined here, we laid out a 5.5-month engagement plan, which we're looking for really some meaningful engagement. We're careful in that to navigate around obviously the forthcoming PERDA period, and also we've tried to avoid there the sort of school holidays, whatever holidays those might look like this year as well. But really ensuring that we've got that engagement to inform our business case, which we can then submit and put us in the best possible place in that sort of effectively national competition for funding for the RUH and the Baines community. So, Chair, if you're happy, I'll just pause there. Happy to take any questions on that.
Right.
I should introduce David Rez, as you said, who is our communications lead, and Sheena Hobbs has also joined today, who will be taking that forward. So to 2 colleagues there from the RUH.
Right, so when you previously came to us, Simon, there was this bid of 450,000, and I think there was an understanding that we were going for that, and that was that, and it was just a matter of process. But it's a little bit more involved than that, and you have to demonstrate in your bid for that money that you've got the public, all the service users on side. And it's a step-by-step process, and it's going to go longer than we first anticipated. Now it goes through. I think I'm just having a look now. It goes through initially till 2025, and then it's probably likely to reach fruition between years 2025 and 29. So if you can establish that's the case.
Yeah, certainly. So when I first, I think the first few meetings I came to was in September, and I set out in then that we would be invited to bid for 450 million, and that was up until 2029. Okay, so that was the horizon we were looking at.
Yeah.
I should say the 450 million does include the new Dyson Cancer Centre, which we are very, very close to having agreed by the Treasury, so that's imminent, and that accounts for 42 million of the 450. Okay, so we're expecting an announcement very, very soon, the good news of that going ahead. From our point of view, what we are looking to do is to actually, we want to move really quickly on this for the rest of the funding. And so we're actually looking to try and accelerate, if possible, the delivery of some of the other changes beyond the cancer centre, and doing that in the spending period we're about to enter. So was describing to the chair and vice chair last week that the government gives chunks of capital funding to the NHS in 4-year blocks. So that's about to start actually, April this year through to March 25, and then there's another 4-year block after that, which hasn't yet been determined how much that is. What we're really keen to do is to try and take advantage of any funding in addition to the cancer centre that we can make use of over the next 4 years, the 4 years that start the 1st of April this year, if that makes sense. So 21 through to 25. And that's part. So the only thing that's changed since when I initially presented in September is we're actually looking to try and do this faster and bring the benefits to the population of BAMES quicker. But to do that, we are having to we want to move quickly in terms of getting that business case submitted. In terms of the public engagement, you're absolutely right, Chair. It's important to do that. For us, that's not we don't see it as a tick box thing. That's something we want to do because actually we want people to join us to help us work out what the answers are and to shape the future on this. It's being led by a number of clinicians, and what we're looking to do is to make sure that we're adding to those core groups. We're adding members of the public and advocates, representatives who can inform that and complete that sort of holistic thinking that we need.
Okay, Liz.
I was very busy scribbling what you were saying down, Simon, and thank you very much for a very comprehensive report, because I think you've just answered my question, because I was very much intrigued by your community engagement calendar and having 2 general online open public meetings per calendar month, which is quite impressive. And I wondered what these will be about and how will you decide what items to put on the agenda, but I think you've just answered it, actually.
Okay. Good.
Thanks.
Okay, so as you're satisfied, Liz, we'll move on to Kevin.
Yes, thank you, Vic. Simon, it's probably, again, my lack of knowledge, and it's probably very clear to you. So I was just clarifying on your page 81, the clinical vision. Does your full integration to point 3 include the healthcare, and is that sort of taken as read as the way you've written it? So people like your good self would understand it means healthcare and all those sort of things, rather than, because my definition of primary care may be more physical and social care. I understand those two, but I didn't know whether mental health was in there as well.
So yeah, the short answer is yes, it would include mental health. Absolutely. It's an artificial boundary between physical and mental health in terms of the way services are often delivered, and we want to tear that boundary down so far as we can, so that the patients that are showing up at ED who have mental health needs, that we've got provision for them, as an example there. I think the word integration is interesting because it's often used, but it means different things to different people, and sometimes it's used as a end of itself. It's almost like an ideology, as it were, and I'm really keen to see that integration ultimately is something which we can see how that benefits patients. So whether that's ensuring that we haven't got to have the same conversation twice, 3 times with different healthcare professionals or with social care, so the reducing number of handoffs between different care settings, and ensuring that we've got proper care records that mean everyone's got the same information about us to support us as patients, for example. That's something we're really keen to do, is to define how that integration is actually going to be of benefit to the population.
Alison.
Yes, just quickly, your engagement plan is really ambitious and impressive, and I imagine very challenging given the situation that we're in, because obviously it's so difficult to get groups of people together, etc., etc. And we are so reliant on technology to bring people together. And I suppose a big challenge is people who don't use technology. And you know, I'm certainly aware of people who live in my ward who are unable to participate in engagement processes because they don't. So I guess as we come out of lockdown, you'll be trying to do more sort of real meetings, socially distanced, etc., wherever possible, to try and get as many people as possible participating. So that's one comment. And the other one is just to say, where you are using technology and portals and things, I do think an awful lot of people get put off by things that are technologically quite complex. So I think the simpler you can make it and the fewer clicks there are and the less jargon and your sort of IT sophistication you need to have in order to engage with it, the better. So that would just be my plea, really, that you try and make it as simple as possible, because I think that way you really will get more people engaging and participating, and then you'll have a much better understanding of what's actually needed. Thanks.
Thank you, that's very helpful. Dave, is there anything you'd like to respond to that as well?
Just briefly, thank you. Thank you, yeah. Councillor. Just to say, sort of agree with that, and thank you for the comments on the plan. We'll introduce things like that to do that, and that's where we sort of be looking for support really from. So, for example, for yourselves, when we're back open we'll have open offer to attend your ward meetings if you want, your residents' meetings, to come and talk to them about it. But also to make sure we work, for example, with age concern. You know, we know 36% increasing over 75s. We know the proportion digitally excluded varies across the piece, but with all the third sector, where they have got these links and they can advise us, okay, what's the best way to go to these people? I think we're just very conscious as well that paper information is still key. We need to have information leaflets, and people who want to respond to a survey by a phone line or by writing something down and sending it back, we've got to make sure they're all covered off as well. Absolutely. So it's going to be comprehensive in those terms. And what we're saying is we need to go to where the audience is, where people are, where it's sort of common to them, where they want to get out of COVID. And if that means direct mailing to large groups of cohorts of people, then that's that could be part of it, with in partnership with charities, with the mental health trust, with those people who may be digitally excluded. So I absolutely agree with that, and very passionate about that. We don't want to miss anybody out.
On your vision and etc., when does it physically start?
So sorry,
this engagement process, when does it start, and when do you propose it will? You're satisfied that it's going to be completed?
Yeah. Okay. So the reason we hadn't got the dates there, because we're just confirming those at the moment. We're hoping to start this engagement process actually next week, with starting with staff, and almost immediately afterwards with the public and patients. But we're conscious that we've got PERLA there, so there's 2 weeks, a short 2-week engagement process. And one of the key things we want to get out of that, Chair, is to recruit willing members of the public and partners who'd want to work with us over the next 6 weeks after that, and with our clinical leads to be developing the care model we talked about. We're then looking to the next phase would be I think the 10th of May, which is the week after the local elections. And that would run through till the very start of July. So, and that's probably the main concentrated period there. We want to do that so before holiday season, and that's the point where we'll be seeking people's views and getting people's checking people's priorities and reflections on the care models that are being developed. And then we're looking to then go back to people I think it's towards the end of July, with so sharing with them the conclusions of that, and where we've got to, because that will then be put into our business case, into our bid, which we want to submit to be submitted in the early autumn. So that's the kind of rough timeline, and we're just getting just got a few things to confirm, sort of NHS side, before we go firm on that. But that's our intention, Chair, next week.
Right. So what we've done provisionally is we scheduled that you would be an agenda item on forthcoming meetings. But if you don't have anything, you're not submitting this until the autumn, will you have anything of substance to bring to our next meeting?
So I would expect we would, because we'd be very keen to share with you in May the conclusion, what we've heard back from people during March. We want to be able to share with you what it is we're planning to engage the public with during June and July.
Okay, so it would be for information,
So,
and then if we
yes.
can identify anything outside of what we've done to date,
Yeah.
at that specific time, we might be able to help that way, because this is all important that we're successful in this, because it will bring us, we'll be amongst national leaders in the provision of hospital facilities. So we are very keen to be involved. So thank you for the briefing, Simon and David. I think that we can do no more at the moment than note the intentions. Okay, so thank you very much.
I think, Chair, if I may ask, the thing I was just really keen to check was if the panel was thought this was a helpful engagement approach, with sufficient. And thank you for some comments from Councillor Bourne, for instance. I think you said it was an impressive, albeit ambitious, a plan, which we certainly recognise the ambitious side of it. We're very committed to doing that, but we just want to check we've got the panel's support with this approach, and using the expertise in the room, as it were, before we embark upon it.
I think you can say that you've got the panel's support, and we like ambition. So so we're with you.
Excellent. Okay.
Right. Thank you very much.
Thank you very much.
Thank you. So if I can take you on now to agenda item 13, director's briefing. So that's you, Les.
Great. Yeah, you've got myself, and you've also got Chris Wilford, who's doing the children's one as well. So yes. I really quickly canter through the adult one, because a lot of that, the content already in this report is actually some of the stuff we've discussed. So I won't labour any points that we've already discussed today.
Yes.
So the first point was about the out of hospital discharge to assess arrangements, and we've had a thorough discussion about that and clarified that we're not quite sure what the funding agreement is. The one thing I did want to build on, though, from what Judith had shared earlier, was that so the funding is for anybody being discharged up until and on the 31st of March. So anybody after the 31st, so from the 1st of April, that won't be available from that point. And that's the bit that is yet undecided about how that's going to be taken forward. So if you're discharged up until the 31st of March, then your funding for the D2A will be available up until the mid-May if you need it. So that's just a point of clarifying there. We've also talked about the specialist mental health care and support new procurement arrangement that we've got taking place, and that's been alluded to as well. And this is in relation to packages of care and support for people that are in specialist independence at home services, for people in supported living services, and for people in specialist residential care homes. It's not new funding, I hasten to add. It's or new or additional funding. This is about a framework for managing the provision that we've got within that existing budget arrangement. So we did talk about that earlier. Councillor Appleyard raised it. The third thing I wanted to draw your attention to is the mental health white paper. We haven't mentioned that to date. It came out in January 2021. It is called a white paper, but it's a consultation document at the moment, and that consultation ends, I think it's mid-April from memory. Yeah, consultation is due to end on the 14th of April. It's an important change actually in terms of mental health requirements, and there's significant recommendations in there which we are working through now. There is a concern about how it deals with mental health aftercare, but that will be some of the feedback that we give. So the reason for alerting the panel to that, it says that it's twofold actually, but that's the reason for is one, to raise your awareness of the fact that that white paper is out there, but also to let you know that we're doing some work in terms of the impact statement on that and looking at what the potential impact will be for the local authority and for the health service as well in terms of that. So we can share our response if you'd like to see a copy of that, but obviously that's not available just yet. The fourth thing is we're letting you know that we are doing a consultation, about to go out to consultation in regard to introducing a standard rate for direct payments, for people in receipt of a direct payment and the way that they fund their personal assistance. So we haven't got a standard PA hourly rate. And what we would like to do is we're going out for a 12-week consultation with people for a fixed rate for both children and adults personal assistance. It will be helpful because it will just helpful for us to have a level playing field in terms of that. We're presenting 2 different cost models as part of that consultation. You will be invited to the consultation events as you were to other consultations that we've done. So please do make the most of those and attend if you can. And some of you that will remember when we did the charging and financial assessment consultation, a couple of you certainly came to the ones at Keynsham with myself, and there were some direct payments users present at that session. So I think they will again be particularly wanting to be part of this consultation and to give feedback on it. So I think it will be helpful for that group to be particularly involved in this. So we will let you know when those consultation events are on. The other interesting development that we've done is while we've been working particularly through this last wave of COVID, so the Christmas to the mid-February, March period, is the health system often talks about the pressures in the system through what's called the operational pressure escalation levels, the OPAL ratings. Some of you will be familiar with that and some of you won't. We don't have anything similar from an adult social care perspective. And the team have been working hard to develop our own adult social care rating system. And we meet every week. We were meeting 3 times a week when we were in the height of wave 2, but we meet every week now to go through how we think the adult social care system as a whole is performing and what level of risk we've got. And Judith, who's on the call today, has kindly been setting those up for us over the last few weeks. And we are reporting at the moment that across the whole of the adult social care sector, we're on OPAL 2. We also look at during that whether we are anywhere near the Care Act easements, and Helen Wakeling and Karen New King have a view on that and particularly give a focus to that bit of these meetings. And looking at that takes into consideration what assessments we've got outstanding from an adult social care act assessment, but also what reviews are looking like, and it also takes account of what our occupational health assessments are looking like. So we've developed this rating and we're finding it particularly useful for ourselves to have it in place. And as I say, we go through the spreadsheet certainly now once a week, and then we report it into the local authority senior leadership team, and then that goes onto our dashboard so everybody knows how we are. We also report it into the CCG so that it can be fed across Bain, Swindon and Wiltshire CCG as a whole, so that actually everybody on the system should know. And we have the weekly or bi-weekly now, they've gone to community hub calls where it gets fed into. So that's quite an interesting development that we've got. And then finally, what we've got is that you've alluded to already today a couple of times, the white paper, the integration and innovation working together to improve health and social care. And certainly Dr. Brimbird mentioned it, didn't he, and you had some questions around that at the earlier part of this meeting when he gave that update there. So I've just acknowledged some of the bits, particularly from an adult social care perspective, that ADAS, the director of the National Association for the Directors of Adult Social, said what the Southwest are thinking of reporting. So I've pulled some bits out that are of interest to that, but you can see it talks about Locality, it talks about the integrated care system and around health and care partnerships and what's that relationship going to look like with health and wellbeing boards, and that there isn't any clarity on that yet. That needs some further explaining. But also, it also talks about joint commissioning, joint committees, which you've alluded to. And then I think the other bit, though, to reference from a social care perspective is that bit around they're introducing adult social care assurance and more data being reported. And whilst we obviously want to be as transparent as possible, but we need to just wait and see what that kind of looks like. So actually, there's been quite a lot of activity taking place, not least managing COVID, but there's been a lot of work taking place as well over these last few months since the last panel meeting. But before I depart, I did want to formally introduce you. I know that Councillor Appleyard introduced Alison Elliott, who's with us on this call today. Here she is on the screen. This is Alison. Alison's the new Interim Director of Adult Social Care. She's got a great lot of experience that she's bringing with us, and we've had a good opportunity to do a very good handover, which has been great actually. So I feel hopefully Alison will feel very versed in what's happening, and it's great she's had the opportunity today to come and sit on panel, so she knows exactly the things that you're looking for, particularly for some of the areas raised today. So I don't know if you want to say anything, Alison. Don't want to put you on the spot.
No, thank you, Leslie. And just to say to colleagues, members, Leslie has been absolutely brilliant in terms of the handover she's given me. So hopefully that will help us transition into a new relationship, but actually take on board all the work that you have been doing as a panel and that Leslie has been supporting you with. So hopefully there won't be any gaps, but please tell me if there are.
Yes, and welcome, Alison, welcome.
Thank you.
Actually, you might not appreciate it as a welcome when we give you a bit of a bashing later on in future meetings, but there.
I wouldn't expect anything less.
Right. So if I can pass, there are no any questions for Les? No, you gave us a we drowned us, you did, Les, there. So.
Well, I do try. There's a lot going on. It's massive, isn't it, at the moment?
Absolutely, yeah. So if I can ask, now it's Chris, you're going to do the Children's Services report.
I am indeed. Thank you very much, Councillor Pritchard. Mary is having some well-earned annual leave, which she's hardly taken through the COVID period. So I've agreed to stand in for her today in the report. So a few updates from Mary's side of the business. So she wanted to let you know that Children's Services had their first practice week at the end of January. And they focused on their work with care leavers. This enabled other people to get involved with observing some of the really fantastic and inspiring practice that team does. And our lead member and chief executive took part in that week as well. And it was, the team had an opportunity to showcase the work that they've done. All the Children's Services colleagues continue to work hard to make sure that all the statutory timescales are being met during lockdown in terms of seeing children and making sure children are assessed. And Children's Service colleagues are very much looking forward to starting to work through the different phases of a lockdown coming to a close and being able to get back to doing more of the face-to-face work which they're used to on a longer term scale, hopefully. Children's Social Care have redesigned the safeguarding outcomes part of their service in June 2020. The service is currently finalising its evaluation report to consider the positives that this has brought to practice and the outcomes for our children and families. And I'm sure Mary will be able to come and say a little bit more about that evaluation report at the next meeting. Just also to let panel know that Ofsted have now resumed their assurance visits for children's social care. And for schools, Ofsted's inspection framework for schools will start again, I believe, in terms 5 or 6. So we'll wait to see more about that. Just also to reassure the panel that during this lockdown, Bain's staff from social care and education have continued to ensure that vulnerable children and children with a social worker on EHCP have had access to an education placement, if that was considered the right place for them to be. Baines schools, I think, have been fantastic in supporting the most vulnerable of children. And as a result, Baines had one of the highest school attendance rates of vulnerable children in the Southwest. So schools worked alongside social work colleagues to make sure that children who should have been accessing a placement during lockdown were given that opportunity. So I think that's real positive. That was complemented by our continued expansion of the virtual schools. So some of you may have been to corporate parenting earlier in the week would have heard a little bit more about the expansion of the virtual school. That's been fantastic in terms of being able to provide that additional educational support for children in need and children on a child protection plan. And it's probably right for me to also mention that obviously schools returned this week. Primary schools started back fully on Monday. Secondary schools are going through a more staggered approach as they test all the children before they return to education. That will be a little bit different in each secondary school in Baines. So some of the small secondary schools will be able to get all of their children tested and have children back in the full-time education at the end of this week. Some of the larger ones, I suspect, some of the larger schools will start back with all their children the following week. We'll continue to support schools where we can. Our education psychology service continues to operate to deliver online training and bespoke sessions for both children and staff to support mental health and well-being. And we'll provide the support that schools need in terms of thinking about what additional needs there might be for children, which I'm sure they'll start to discover as the rest of this period of schools being open continues. That's it from me. Thank you.
Thank you, Chris. It was at the corporate parenting, it was mentioned about the virtual schools and looked after children there have actually excelled during this period, which is against the national trends. So that's to be commended, certainly. Are there any questions for Chris? I don't see any. You can do it by a wave or whatever. No, thank you very much, Chris. So again, we've gone exceedingly long time at this panel, and now it's 13:48. So thank all of you that have stuck with it right to the end. I know some people have had to go, they've been called away, but thank you for supporting all the way through. And Les, just a final word to you. It's difficult to make a mark of appreciation that's worthy of someone so committed to supporting the welfare of those that most need. And you are, I'm going to say, a sincerely and exceptionally nice person, and all the very best going forward to you. So thank you. And with that, I'm going to close the meeting.